conduct will be?
Welcome, everyone. This is the Expanded Budget Committee of the Tompkins County Budget, Capital, and Personnel Committee of Tompkins County. Today is September 25th, 2025. We have the last of our presentations going on tonight. Some of them are pretty meaty, so it's going to take some time. So think about your questions and let's try to be crisp and try to get through this so we can get home before midnight, shall we? Our first presenters tonight will be our Department of Social Services. Our Commissioner, Brittany Earle, I guess Tom Toll and Dina Bodner are here as well. So, come on up.
You sat with my husband today. Yeah, he mentioned that. I think he's pretty decent. Yeah. That's my guy.
You might even get Dan. What's that? I sure could. Yeah.
Amy Carmack just emailed me. I wish I was stuck in traffic, but I
Oh,
told her.
tell her it's going to be a long time.
It is Thursday.
Hello, I'm Brittany Earle, the Commissioner with Social Services. They're getting our presentation pulled up, and I'd like to introduce my team that's here with me tonight. I have my two deputies, Donna Scott and Dina Bodner, and I have my Director of Administration, Thomas Toll, who has been indispensable in helping me with this.
Welcome. Glad you're all here.
Thank you.
Just getting the technical stuff done here.
Okay, good.
Whenever you're ready.
All right. So we are the Department of Social Services. I won't read our department purpose verbatim, but the Department of Social Services plays a vital role in supporting individuals and families in need, and we primarily do this.
It's not changing up there.
Oh, hold on. Good. Technical difficulties. Okay, so the Department of Social Services, we play a vital role in supporting individuals and families in need, and we primarily do this by administering federal and state entitlement programs with some support from local or grant-funded initiatives. So our eligibility workers are on the front lines determining who qualifies for public assistance, and through these programs, we help people meet essential needs like food, shelter, heating, and utilities. Our caseworkers are involved with our vulnerable populations in the community, including children, adults, and families at risk. And this includes providing adult protective services, managing child welfare services, including prevention, foster care, detention, and adoption. And a major focus of our work is on prevention, especially in children's services. We strive to reduce the need for out-of-home placements through early supportive interventions. And lastly, the department focuses on helping clients build long-term stability by working with partner agencies in the community who provide employment services, job training, education, independent living, and support while navigating our DSS system, all geared toward increasing self-sufficiency and independence. So our FTE report So the 3 positions that you see here for 2026 have already been added to our budget by resolution. So we added a senior account clerk typist, we added a principal social welfare examiner, and we added a senior caseworker. So all of these were to help with shelter and case management. And after that, we then converted the principal social welfare examiner to a senior caseworker to align it more with the population, or to align it more with the position that was created for family-centered case management program that the state has set up. And the reason for doing that is because we realized the position was less about eligibility and more about managing cases, which wasn't realized initially when it was created. So here we have 2 pie charts. So the one on the left shows how much of our budget is already committed to mandated services. So 61% of all department expenses go towards programs that we're legally required to deliver. Things like Medicaid, SNAP, HEAP, child welfare, child support, children's services, and daycare. And then the pie chart on the right shows a percentage breakdown of our largest programs, which include eligibility services, which is also children's services and adult protective services, daycare, and administration. So important to note about daycare is that it spans both eligibility and services. And so daycare is subsidies paid to families for children in daycare and summer camps. So we wanted to highlight some budget pressures and some known unknowns looking ahead. So looking ahead, there's several budget variables that we're monitoring closely. Some will likely increase our workload, like changes to SNAP, Medicaid, and HEAP requirements, as well as the proposed Adult Protective Services Hotline Registry, which would require staffing and compliance resources. So the state has been discussing the APS hotline for a while. It was on our budget last year as a known unknown. It is still something the state says is coming. Child care remains a complex challenge with expanded eligibility and increased market rates. Local share costs have grown significantly. It's a mandated service, but the funding hasn't caught up, and we're awaiting additional guidance on this, and we will adjust as needed for 2026. We're also in the process of restructuring shelter contracts to create consistency across our sites, and we're assessing what the full financial impact will be of a shelter provider taking over. So VOA has committed to the Cherry Street site, which doesn't affect this budget, but we're also in the works to have them help us with Code Blue and our THA location out at the roadway site. So we're committed to maintaining our service quality and being fiscally responsible while we determine what this looks like. And then lastly, treatment and congregate care options, especially for youth in the community, continue to pose challenges across the state and impact local placement costs. So looking here at our MOE detail, so looking at first at child care, this is paid through the New York State Child Care Block Grant. And what you see is a $680,000 increase in the local cost as currently planned. So that is minus our maintenance of effort from last year, which was roughly the $70,752. So in previous years, the child care was fully covered minus your maintenance of effort. That's not the case now with expanded eligibility and increased market rates. So that expanded eligibility and increased market rates have driven up expenses to the point where it exceeds our allocation, which is roughly $4.7 million, which means a local cost increase, which amounts to the net local increase of the $680,000. So we are working with county government, and we are awaiting more news from the state on what the full impact of this will be throughout 2026, but we will keep the legislature apprised of what that looks like. So to kind of give you a hint was last week, I believe, we received additional allocation for childcare for this year. So the state continues to assess this, and that's our estimate of, that's where we're currently at. That is a potential it could change based on what the state says.
I have a question just regards to clarification. What account numbers are you referring to? Because we're looking in our binders and some of the account numbers that we see are much different numbers than what you have up there. I'm looking on page 274 and account number 6119 childcare.
That's the Children's Services childcare. This is referring to the 60-55 childcare, formerly daycare. It gets confusing the way the state refers to the programs.
Okay. And that's not, yeah.
Daycare.
Yeah, so if you look at the 60-55, you'll see that the total at the bottom is $744,309. So that is the local cost, but minus our MOE of the $70,752 from last year, that brings it down to a $680,000 increase in local cost for this coming year. And looking at the Children's Services line next, so Children's Services, this covers child preventative services, child protective services, foster care, kinship, guardianship, and adoption subsidies. We get a 62% state reimbursement and net of federal, which comes out to roughly the $41,417 in local cost increase. Looking at the contract increases, so we have numerous small contracts with local partner agencies that cover services like parenting education, mental health and multi-systemic therapy, basic needs supplies, system navigation, life skills, and child preventative services. So these are through like Cornell Cooperative Extension, their Learning Web, and those what you see here is a total of all of those contract increases together rather than listing all of them out because there's numerous of them. And that local cost increase is about $102,682. In looking at family assistance, so this is emergency assistance and temporary assistance to families, and it is nearly 100% federally reimbursed. So it's a very minor cost increase for the local community. And looking at safety net, this is a state mandated program for single individuals without children and families who have gone beyond the 60 months of eligibility with family assistance. So what's unique to New York is that this provides support to adult individuals, which is not true elsewhere. And we received 29% reimbursement of net of federal. So the local cost increase for this year is $609,218. Can you move it, Norma? Oh, thank you, sorry. All right, so in looking at the new detail, the Steuben County detention bed. So this is a request that was not supported by county admin. This request supports placement for youth involved in the juvenile justice system. And without it, we would be required to find placement for the youth, which is increasingly difficult and expensive across the state. Numerous counties are struggling to place youth in detention right now and are having to find other means of doing so, which can mean finding placement in another state, or it could mean finding placement for the youth at like the sheriff's office, which is our current option for providing 24/7 monitoring is the sheriff's office. So not having this can increase our costs down the road. It's really more of a, it's there, we need it, and we don't always use it until we have to use it. So sometimes it looks like it's just sitting there. And the non-contracted daily rate for the Steuben County Detention Facility is at a minimum of $915 per bed per day. So in looking next at the outside THA shelter provider and cuts, so the THA cuts specifically include all shelter expenses aside from salary and fringe. So that includes THA bed use, food, security, and other miscellaneous programmatic costs. And then the and cuts includes our armed security, and our respite bed. And then moving on to the county administrator recommendation for the $3,070,942. So that is looking at the shelter salary and fringe, if we get a shelter provider to take over shelter, which, like I said, we're actively having discussions with VOA and are hopeful that that will happen. And then a portion of this is a formula that was derived from previous years based on staffing and vacancies. Thank you. And then the armed security. So county admin initially it was recommended to cut. It is now recommended to put it back into the budget. And looking at our armed security, so armed security started providing this in 2023. And since 2023, our workplace violence incidents have decreased by roughly 50% since armed security started, which is fantastic. So, that's it. Any questions?
Shauna.
Thank you. I have a few questions. I was wondering for the shelter salary, the $3 million, is there any amount of that we can also consider in revenues that we're going to be reimbursed for Code Blue?
So that's separate from Code Blue. Code
I understand,
Blue,
yeah.
Yeah. So any amount that we decrease in salary and wage, we do lose that reimbursement.
So I can say about Code Blue, which we didn't include in here, is our $2 million allocation. We're hopeful we will get that, but again, the state hasn't given us any guidance on what our allocation will be for
Okay.
Code Blue specifically.
Okay. And then I have a few other little questions. On page 268 of our budget book, under consolidated budget for Department of Social Services, can you talk a little bit about the overtime and why the overtime is at $184,000 for the year? That seems a little bit high.
Yeah, so this is increased overtime needs for shelter. So as we started providing services through the county for shelter, that has increased the cost of staffing and 24/7 care. So shelter is, unfortunately, you never have a day off at shelter. So if there's a crisis, if there's someone who we need to respond to immediately, or we need to get resources to, or someone moves in, out, anything can happen. So that increased cost is for shelter.
So if you get the amount, the $3 million for the shelter salary, would you no longer need the overtime?
We would still need some of the overtime for our normal caseworkers that handle the day-to-day.
Yeah, and to highlight is that the increase in, going back to our FTEs, that's what we know. And what we don't know is looking at the additional requirements for HEAP, SNAP, Medicaid, that's going to have a trickle-down effect. Mm-hmm. So if a family loses housing, if a family loses food, like there's a greater likelihood they're going to have an interaction with our system. And that could either look like children's services, it could look like shelter. So it's hard to say, but that could still increase, and our staffing need could increase too, and have to come back to pledge.
I would hope that as the year goes by and we see some of these trickle effects, that you would keep us posted.
Absolutely.
Because, I mean, there needs to be a back and forth communication to the legislature to let us know that if you're seeing people losing benefits, losing SNAP, losing Medicaid, that we're knowing about it sooner than later, so that we can, pay out of fund balance or figure out a way so that we can provide those services.
Absolutely.
Thank you.
And the department as a whole is also working with community providers, and I've been working with Cindy at the Human Services Coalition to really address the gaps that might be created by people losing benefits.
Thank you.
Randy Brown.
Thanks for being here and bringing everybody. It's complicated to put all this together, so thank you. One of the things that you showed that I think 61% is mandated cost. Mm-hmm. That means 39% isn't, which is about $25 million. Could you, not now, but just kind of send us something to say this is what the $25 million is going towards?
Yes, I can do that,
So
absolutely.
don't explain that one now. The changes in SNAP that are coming your way. There are organizations that want to help pre-qualify people, which I think would save some time for DSS and evaluation. So when people get to you, you know they're already at least to that point. So that's something that I know other organizations have offered that help. So.
Yeah. So it gets a little tricky. Eligibility does. There's a lot of ins and outs of it. I'm not an expert in eligibility, and my eligibility director is deservingly on vacation. However, there are so many nuances to determining eligibility that we will work with partner agencies to the extent that we can, because I agree to what extent we can to help pre-fill things, but there's, like I said, a lot of nuances. So part of working with Cindy is identifying what can we do with partner agencies to help this process.
Yeah, and I think there's one or two other ones too that are at least involved in speaking to people and explaining to them how it works and whatnot. So I'm looking at your revenues, and one of the things I'm looking at is daycare, which you said is now childcare. Did they change the name or that? But anyways, it shows in your program expense in '24 was a little over $4 million, and your budget for 2025 was $3.8 million, and you're about $3.4 million so far this year. So it looks to me like you're going to exceed that account, but you've got your revenues also picked up, so it looks like they'll be over as well.
Correct.
Is that what you expect?
Yes, we're looking to do a resolution in October for that.
Okay, but then you're looking at a huge increase for 2026 for the program expense to $5.2 million, and you're looking, your revenue is going to be, and that's where you came up with the 744. That's the difference going to be over last year?
Yes. So the allocations run on the federal fiscal year, so they end in September. And we had just shy of forecasting out about $100,000. But as Brittany said, it was actually last month that we got an extra allocation of $305,000, which will get paid out for this federal fiscal year. That would actually help cover that $100,000 shortage for the federal fiscal year against our allocations that, ended or it's going to end next week.
Yeah.
Yeah. So we had previous year rollovers also that allowed us to exceed the amount that was allocated to us through the child care block grant. This coming year, we don't know if we're going to get those extra allocations. We were told there's not going to be any rollover from that $300,000 that was granted to us. So that's, as we get more information, the state is really good about trying to communicate. We had, I think, 5 different updates throughout this past year about our allocation that is ending shortly, so.
Yeah.
Okay. I see your client transportation cost is going up quite a bit as well. What's happening there?
So a lot of that is court-ordered transportation for trying to keep families together. So, we may have a client who lives who was here. The child could be I'm just trying to think of like in Berkshire, one of the parents lives in Syracuse, one of the parents lives in Homer, and they have to come here for their court cases, but then they also have to do visitations with the child from wherever they are to wherever the child is located.
That's a mandated expense?
Yes.
Okay. My last question. So I'm looking at your revenue totals year to date, and it looks to me like your revenue expectation was about $35 million, but you're about 17 million, about half of that so far through the end of September. So are you going to reach those projections, or something change there? Or?
So we should hopefully reach those projections. Our reimbursement always runs about 2 to 3 months behind when we actually make the claims and expend the money or expend the funds that we use. So some of the amounts that we'll receive will be received in January and February, but they'll count for this year.
Okay. Thank you.
Dan Klein.
So part of the federal changes that are coming involve employment verification, and that's going to fall in your department. Is that accurate so far?
Yes.
And I've heard that that starts October 1st of 2026. Is that accurate? Do you know?
Yes. Yes.
Is that, so we need more staff doing that as of October 1st next year?
Potentially. So we're looking at other options to help with the workload. We're looking at using potentially AI, which is used across the state with agencies. And we've been having meetings with other counties who use this technology. It's approved by OCFS and OTDA, and it has substantially reduced the workload for a lot of things like this, applications, verifying employment, things like that.
So there's a scenario where we don't need more staff in order to meet those new federal requirements?
There's potentially an option. I can't say that for sure.
Right.
I mean, AI can potentially do a portion of that. It won't do all of it. And there's no, I cannot say with confidence that these cuts will not trickle down to other areas. Like if someone loses housing and loses their food and they then come into our shelter system, that cost is increasing for shelter. So we're not sure yet how that will look. But again, I'm working with partner agencies to help address these gaps before they become issues, and working with other counties to see what they're doing, things like the AI that could potentially help us mitigate the number of extra positions that we need to ask for. And help staff, right? Because if we can't get more positions, then staff's workload increases, and that just increases burnout and the attention that we can give to each case.
So is there anything in this budget covering that potential extra staff need?
No, because it's an unknown at this point. And because it's such an unknown, we don't know what we would need to request. The state has been giving very minimal guidance, which is unfortunate. And a lot of things on state time run slow. So unfortunately, I don't have a great answer for that. We will continue to look at our budget, look at where we can get creative, where we can, like I said, get creative. So we have converted other positions based on community need, so positions that we weren't using. So we converted them to fulfill positions that we did need that were already in our budget, so we didn't have to ask for an extra position, but we got creative so that we could create that position without creating the need for an increase in budget.
Great. And then my only other thought about that is that if these requirements kick in October 1st, and if there's either existing staff or new staff that have to take care of that they probably need to be hired and or trained earlier than that, right?
Yeah.
Okay.
Yeah.
Thanks.
And Corman.
Thank you for the presentation. And I appreciate that you're dealing with a lot of things right now in the next couple of years also, so thank you. And knowns and unknowns. So two questions. One is regarding the youth detention bed. So for the number of days that it's historically been used in the last few years, do you have that?
I do. Give me a second, though. So detention bed, no, we've minimally used the detention bed. Respite bed we've used quite a bit. That the numbers I have are for the respite bed. I apologize. Detention we have used very minimally.
Okay, I think it was
Knock on wood.
was the youth detention bed that we saw in your presentation.
Yes.
For 250,000.
So I just wanted to add that we did analysis with the previous commissioner, and I think for the last 3 years, the number of days we used those beds was about 100 days, 113 days. And some of those days were simultaneous with others. They have multiple kids in the bed, so we made some of these decisions around the usability of it, because at the end of the day, if there's a child in the bed, we get reimbursement. But if there's no child in the bed, we still pay for it, but that's from the local dollars. So some of those tough decisions were made in line with some of the known factors. But this year, for example, we had few instances that the sheriff's office had to keep somebody because we didn't have access to a bed somewhere else. So it's very difficult decision points to make, but some of those adjustments as a result of where we started from and where we try to land with the budget, as we try to make as many adjustments as possible to fit within the expectation of the legislature.
So we're not reserving any certain amount of money for that, even though we're not, say, reserving one respite bed. Are we setting aside, budgeting any type of money for that?
There's two concerns around that. So one is, if you have paid bed and there's a child that needs to go into that bed, we can easily access that bed within a few days. We do not have a paid for bed. That means we are subject to what is available. And that's what we suffered this year, that we're trying to find a bed that we couldn't find one. Some of those decision points were also behind the significant contingent account increase that we've done. So in case the need arises, we may be able to pivot to using some contingent fund to support us to be able to cover some of those costs. So, but the difficulty is we may have a child, but there's no bed available anywhere. And we had an encounter like that this earlier on this year when the sheriff's office had to sit with somebody at their interview room for a couple of days before the court, I believe, send the kids somewhere else. So those are some of the things. You may have the money, but you may not have the bed available anywhere else that you can send a child to.
Yeah, yeah, we're not required to. Even if we have, like the course has said, even if we have the bed, there's no guarantee that that bed is empty just because we have it on what you would think hold.
Oh, really?
They can fill that bed. So it's kind of like a double whammy.
So you could be.
You'd be paying for it, but someone else could be in it also paying for it.
And still have to pay
Yeah.
for somewhere else. And then the other question was regarding SNAP benefits, which I'm sure you can imagine is a big concern for us.
Yes.
So, you know, as Shauna asked about, you know, being kept abreast of that. And so I don't know if you can answer this now, but maybe part of the conversation as we go forward, because I'm just wondering, you know, how do we keep track of those folks? Are they still going to be eligible? Are you still going to have information from your department or agencies in the community going to help us? I would imagine agencies in the community would help us distribute food. But so anyway, just trying to, I don't know if you have any ideas.
Yes. So we will continue to work with partner agencies to address this, to understand the full extent of how many people might be harmed by a loss of benefits. It's nuanced. I know I keep saying that. It's tricky. It depends on how many, if there's children in the family, how many children, the ages of the children, the parents' income. There's all these different criteria that factor into someone receiving benefits and whether or not they will lose them. And my eligibility director is continuously looking at the data and running numbers. Again, those numbers, it can sometimes be hard to narrow it down because families, depending on children and other like ages and number of children in the family, there's so many factors. So it's really hard to get a solid number right now. As the state gives us more guidance and as we know more, we will absolutely provide updates to the legislature. Right now, the state hasn't really been giving us much information, unfortunately.
Okay, thank you.
Amanda Champion.
Yeah, thank you so much for the presentation. I just wasn't sure if I misheard you about the security. It was recommended to be taken out, but it's being recommended to put back in.
It is.
Okay.
I don't know if
Corsa?
Corsa was going to say something, so.
So initially, as at, I believe, June, July, when we started looking at our various options, we made a decision that going into 2026, because we have now countywide security services, they will be taking over the security across all the county departments. So last week, we met, first have a detailed conversation around what the needs are and some of the things that we need to do. As part of the decision, we may have a contract adjustment, but there was some degree of consensus around maintaining at least one armed security at the reception. And so we made a determination that we could, we will bring a request to you guys during your voting process to capture that back into the budget, because per the guidance from the security at the meetings, we've believed that maintaining at least one armed security will be helpful for providing the services that they provide currently. But we may have some adjustment with the numbers, so there may be cost savings elsewhere to mitigate that, maintaining that cost for the armed security.
Okay, yeah, I mean, obviously I want security and to have that, that's a large number to then put back in. So.
It's also important to note that we do get some reimbursement for that. It's varied,
Yeah.
but that wouldn't be the full local cost. We do get some reimbursement.
Okay, thanks.
All right. Thank you very much for your presentation tonight. You helped us a lot by coming and talking to us.
Piece of cake, huh?
I've only been here 2 months.
Our next group will be the Whole Health Department. Welcome. Jenny Sutcliffe, our Commissioner, Jerry Porter, Karen Johnson, and whoever else.
Hi, everybody.
Welcome.
The instructions were to share my screen. Is that the right instruction? Okay. Norma was just... All right. Let me, whoop. All right, that looks better. Thank you so much, everybody. It's really nice to see you all. I've had the pleasure and privilege of being able to watch every other budget hearing, and so it's nice to sort of be joining you all on the end, and I hope that we can bring some good energy for tonight around public health. With me, I have our Deputy Commissioner of Operations of Whole Health, Jeremy Porter. I'm sure many of you know him as our fiscal director, fiscal administrator as well. And, you know, many folks, including Karen Johnson, who aren't joining us in person, but really are the real backbone of all of this work and our department that we're sort of sharing with you this evening. I put together a short agenda for what I'm going to talk through. We're going to do a short overview on whole health, a couple of highlights from our department from 2025, and then going to offer a current budget snapshot, including highlights, revenue, also having the benefit of hearing the questions ahead of time. I'm going to hit on them right from the beginning. We'll talk about our revenue, a little bit of our fiscal oversight, and then I want to chat about our community provider funds, and then I'll lead us into kind of our requests for 2026. This is a picture from our WIC clinic, one of our nutrition counselors working with a mom and her new baby. And this is a picture of sort of the whole department. And our mission is that really we're here to build a healthy, equitable community in Tompkins County by addressing root causes of health disparities and integrating mental, physical, and environmental health. You know, we focus at Whole Health on treating the whole person, really thinking about their individual and collective well-being, and try to deliver services holistically that improve health outcomes for Tompkins County residents. This is a picture of our team. We have sort of 3 service pillars. We have our mental health services, operational support services, and our public health services. Within that, we have 7 different divisions. We have 6 operational support teams, and we have around 140 staff. The work we do is incredibly varied. You'll see here on the next slide, you know, we touch everyone from all points of life here in Tompkins County. We have programs for kiddos and babies, newborns, moms, families. We've got programs and services for adults, community programs. We work with businesses. Really, we are a department that is woven into the fabric of all members of Tompkins County. I wanted to share a couple of our highlights from 2025. The first is that our employee retention rate has really significantly improved. Another one is that we've had the opportunity to open a mental health clinic at Brown Road. This has been really wonderful. I think it's really important that we have services downtown at our Green Street location, but we also have a lot of members from the community who prefer to be able to come to our clinic at Brown Road. So that has been a really wonderful addition and something that I'm just getting to take credit for, but all the work was done before I started in this role. The next one is really increased capacity within our operational services. You know, group that you saw earlier, really due to the integration of the 2 different departments. We've also seen an increase in coordination and internal referrals among divisions, people really getting together and identifying needs. And we even had one case where a staff member from the mental health side and a staff member from the public health side were able to do a shared home visit for a community member that was really in need. So I think we're starting to see more of that kind of collaboration and work together. And then we're advancing safety and security efforts at Green Street. I know you heard a bit from Mike and Dewar on sort of the work that they've been doing at Whole Health. You know, this I think is in line with a lot of the work that Brittany sort of also was just talking about. Really, what does it look like to bring safety and security to our buildings, both for our staff and for our clients? And then the care teams. I think this is another one that is a real success. We currently have 3 care teams that are up and running, 2 in partnership with the Sheriff's Office and 1 in partnership with IPD, and we're really looking to expand and grow on those. Oops, I'm losing my slides. Okay. This is a photo of one of our therapists. Our budget snapshot. So our total budget is, you know, $32.5 million. We administer around 28 different programs across the department, and we have 5 funding streams. Those different funding streams include things like state aid, Medicaid and private insurance billing, federal grants, county funding, and then a small amount of philanthropic funding. A couple of our budget highlights from the past year. We wanted to really note that we included our care teams in our operating budget rather than coming in and asking for those as an enhancement. We also included the early intervention providers and stipends in our budget rather than asking for those as an enhancement. We include our vehicles in our operating budget, and we'll sort of talk a little bit more about those. And then also, I think I should have probably put this one first. We actually reduced our county target this past year by a little bit over 300,000 for our 2026 operating budget, and just shy of 100,000 in our mandated budget. And we'll talk a little bit more about why this is in a couple of slides. Well, we'll talk about it in this slide. Revenue impacts. So, you know, mental health service rates fees have increased. We've also seen the number of services that we've provided have increased, and our service hours have increased. And so, you know, put a little bit more simply, rates for mental health services are going up. We've been able to increase the volume of services that we're providing, and increase the services we're providing out in the community, which have a higher reimbursement rate. So things like more direct services in schools, more groups that are starting. We just started a group at Titus Towers, for example. Those sorts of services in the community, they receive a higher reimbursement rate. We also have a more stable staffing. As I mentioned, we've had higher retention rates, which means that more stable staffing with lower turnover means we're able to maintain that higher threshold of service delivery. Where previously, if we've had staff overturning, you sort of see this with your service delivery, and we've really been able to kind of continue to see that rise because of this more stable staffing. And so this leads to an overall increase in revenue of mental health services by 48% since 2020. So this has been really, tremendous both for our budget, but also obviously really tremendous for the community. And I think for our staff who feel like they are getting to provide something that is really, an important and vital service that they're really passionate about, and in a place where we're able to sort of provide them the backbone to do that in a way that feels secure for them financially. In terms of fiscal oversight, I know this has also been a question that has been raised a couple of times, so I thought I would get ahead of it. We have ongoing review by our Deputy Commissioner for Whole Health Operations. Jeremy looks at our budget probably every day. He has a wonderful finance team. We also have an in-house quality assurance and improvement team. And then we have a billing team. And partially because we bill for services, I think that also leads to sort of a higher degree of oversight because, frankly, we want to be reimbursed for the things that we do. And so we want to make sure that we are submitting the billing and doing the things correctly. Otherwise, we will not be reimbursed for those services. On the public health side, public health programs are reviewed quarterly by the New York State Department of Health. And on the mental health side, we're actually audited annually by the New York State Office of Mental Health, and they conduct both a fiscal audit and a regulatory review. Community provider funds. I think this maybe is a little bit unique to whole health. So we have several mental health community organizations that receive pass-through funding from us. This is a function of the local government unit under New York State mental hygiene law, and the funding for this comes from state funding pools. And so some of these examples of providers that receive this type of funding are things like the Mental Health Association, Cuga Addiction and Recovery Services, the Ithaca Youth Bureau, and RACR. All right, budget requests for 2026. So this is our FTE report. We're requesting 4.33 new staff lines. This is a bit tricky because the reality is that we have sort of shifting sands, if you will, on our staffing at all times. And so sometimes we have positions that we're able to move into other positions, we recategorize them and hire onto somebody else. So we actually have several new roles that are sort of starting at the health department, but we're really only requesting sort of 4 new that you see in the budget. Some of the other new roles have been absorbed into our existing budget. So it's hard to say what these 4 new people are doing because there's actually several new folks that are joining us, but it includes things like being able to have a new therapist in our PROS program, a new therapist in our children and youth program, a little bit of a nurse practitioner in psychiatry. I think my role is sort of reflected in some of this juggling around, and then another whole health planner. Our MOE details. So there's 2 things here. One is this interesting nuance around vehicles. So we receive state aid for the vehicles that we have at the health department. So the way that this is historically sort of played out at the county level is that we pay for our own vehicles so that we can get the state match, and then the county pays us back since we're the only department that pays for our own vehicles out of our budget and not out of the county budget. So this, I think, has happened for many, many years, and hopefully is many of you already are sort of familiar with this. So that's one of them. And then the other one is this early intervention stipends. We are hoping actually that these are set to end at the end of next year, and this is because New York State has finally bumped up the rates for early intervention reimbursement. So the higher rates for early intervention reimbursement will mean that we no longer need to have these stipends for our early intervention providers. And then our new enhancements. We have 2 that are reflected in the county administration budget. Those are an epidemiologist and some funding for a coordinator for the Suicide Prevention Council. And then we have 2 that are not reflected in the county administration budget. That's an environmental water health specialist, environmental health specialist for the water program, and then 2 certified peer support specialists. And I'm going to touch on all of these, but I want to first touch on the certified peer specialists. My understanding is that this is a request that came from a community partner. If we did receive these funds, we would RFP these out, and they would be treated just like the other community pass-through dollars that come through our local government unit. So this is, this is a request that came from an outside community partner and is kind of routed through the health department, and then we would issue an RFP for those to go to a community organization, just the way we do for the other funding streams through our local government unit.
Is that budget neutral?
No, those are county dollars. The request is for county dollars. Yep. All right, you can sort of see the breakdown for the new detail here. There is some opioid funding for the epidemiologist, and we have some internal funds for this as we're sort of repurposing a role. And then for the environmental health specialist, there is some state aid that comes through for the salary for that, and then the remaining piece would be a county piece. I want to talk just a little bit about the epidemiologist, or the ones that are sort of recommended. So an epidemiologist really plays a critical role in protecting and improving community health by identifying patterns, causes, and effects in health and community disease conditions. We've got a laundry list of things that we would love to have an epidemiologist work on. I put a couple of use cases sort of here as examples. I think that there's a lot of opportunity for them to dive in around maternal and child health, really looking at data around opioid use here in Tompkins County. We have some research ideas around tick-borne illness and trying to understand particularly prevention strategies for tick-borne illness among elderly populations who are more susceptible to that. Communicable disease is obviously a really big one. I hope that we have thus far still managed to avoid a measles outbreak. And if we get one, I hope that we have hired an epidemiologist at that point in time. And chronic disease prevention. So those are a couple of the things that we think are really important to have an epidemiologist work on. The Suicide Prevention Coalition, so this is funding that contributes to a coordinator role for the Suicide Prevention Coalition. It's housed and supervised by the Suicide Prevention and Crisis Services of Tompkins County. A couple of examples of the work that they have already been doing is sort of facilitating really consistent and meaningful coalition meetings, expanding their membership to include new organizations, reaching underrepresented communities, and really, they've seen so far that efforts have really built a stronger, more engaged coalition and are laying the groundwork for a sustainable community-wide impact on suicide prevention. The environmental health specialist. So this one is kind of interesting. I have some things in my slides here, but I actually wanted to tell a very short story, which is that I got an email from my kiddos' school. They are in preschool. At about 4:30 today, that they had a boil water advisory that was issued, which is something that's issued by the health department. And, as I was sort of sitting here and coming to this presentation, I was like, this is a great way to illustrate why an environmental specialist is really important. So we have folks who do testing for water around the county. They did 1,500 sample types in 2024. The numbers of that have, that's really high because right now we have a fellow that's been able to support and do this work. And that fellowship is ending, I have it in the notes somewhere, sometime in 2026, July 2026. But really with water, you don't know what you don't know. So we test all of the schools, but we do that because we believe it's in best public health practice. New York State actually requires that you only test the water at the schools once every 3 or 5 years. There's like a nuance there, but we try to do it every year. And thus far this fall, we've issued boil water for Caroline Elementary, and then they just issued one for Waldorf. I think this is really important because, in the particular case of the school today, they found, where did my notes go? I had it and then I lost it. There it is. They found that there was a lack of free residual chlorine in the water, and that chlorine is really a key defense against pathogens. It can indicate a failure in the disinfection process. It can lead to bacterial growth and contamination. And so the ability for our team to go out and do this testing is a really preventive measure, because then they're able to issue a boil water notice. My kiddos will be bringing extra water bottles to school tomorrow, and they can work with the team to kind of recorrect and adjust the chlorine levels that are going into the water. I think that this is something that we have really seen an uptick in the demand for this type of work and having a water specialist. This person's also played a role in identifying and thinking and water sampling for HABs, which we've seen an increase in the summer. That's been really important. They support and think about drought monitoring and the implications there. So it's really a varied position that, I think has really important impacts. And so I threw a couple of other things in here. They look for the detection of chemicals. It really protects vulnerable populations. We have 56 federally regulated water systems here in Tompkins County and 95 state-defined water systems. So that's a lot. And with the additional resources that they had from the fellow, they were able to increase the number of boil water orders from 7 in 2023 to 30 in 2024. So, the opportunity here is that there's more places where we may be wanting to issue boil water orders. We just don't know because we don't have the staffing to go out and sort of test and monitor these things. So I just thought I would sort of share that as an example. And I'm realizing I'm pretty sure we issue publicly when we issue a boil water notice. So I don't think I just spilled any beans as I sort of said the school out loud. And again, it's a good thing to get a boil water notice because it means that we've caught something that we can sort of work to fix. It's certainly not punitive. All right, that was all that we had on our end, and would be happy to field your questions.
All right, thank you. Questions, folks? Shauna, then Lee.
Sure, thank you. I have a few questions. I was wondering, as far as the Suicide Prevention Coalition, in years past, we've given them money and it's been through a pass-through, and I wanted to see if that's the case with the current budget. I'm not sure I think it was through OMH. We used to receive money and it went out the door to them. So if we could look into that. And then the second question is why, if they're asking us for funds, would they not have gone through the Human Services Coalition? Or other nonprofit agencies.
For the peer counselors, yeah. I was wondering why this was going through Whole Health as well.
No, for the, this is for the coordinator, right? For the...
Yeah, the suicide prevention coordinator.
Okay.
Okay.
I think that, I don't know, Jeremy, do you know the answer?
As far as, so it's already an ongoing practice. I don't know when it would have been brought forward. We can get why and when for sure.
Okay,
but
great.
I don't know.
And then I did have a few questions. The first one is under the Medicaid insurance payments, and I noticed that for this year we were banking on $5.1 million, and then next year we're expected to get paid more, up to 5.4, and that was recommended by the county administrator. I think my concern is why we would assume that we're going to receive higher revenues if we can also assume that many people's Medicaid would be cut.
Yeah, so, I think it's something that we're certainly thinking about and we're monitoring. I think where we anticipate the higher revenues are for the existing, service rate increases and the things that we're doing that are sort of school-based services that we think I don't think we'll see work requirements come in necessarily in the same way potentially. And then also, I think we actually have found that we have seen an increase in private, or we have a high percentage of private reimbursement rates as well. We have a lower Medicaid population than some of our peer organizations. So I think we've sort of factored that in, and then really just seen these much higher reimbursement rates for the services, and we anticipate still really being able to provide that volume of services. I think we do have a really important role in understanding what happens to people for whom they are no longer on Medicaid and we cannot provide those services, but I don't think we're necessarily concerned that there won't be as many people for us to provide services for that remain on Medicaid. Do you have anything you'd like to add?
No, even, the only thing I would add is that insurances are now also required to pay the higher rate. And so the population being what it is here, it has a little bit, it does have less of an impact. And we would still have to serve all of them that came to our doors. It would just be through sliding fee or whatever insurance that they had. And if there is a drastic change here, we would bring it back to you. But in preparation for this budget, it was primarily with the current understanding, because when we prepared, there wasn't any further information about what to expect.
Okay. And then my last question is in regards to expenses versus revenues in preschool special education. I noticed there's like $100,000 delta, and I'm hoping that's not because we're reducing services to families in need.
No, you're talking about the mandated account.
Yeah.
Yeah, so we've been talking to you all for a while about the not enough providers, not enough kids. And so if there were a significant change in rates in the state that would increase the people who are providing services to provide more services, we may have to expand past that mandate budget. It's based on the last 5 years, though.
Okay.
And those last 5 years are really a significant void in providers. And so while there is a mandate there and we may have to pay more if there ever were more, right now there aren't.
Okay.
There aren't more providers.
Okay, thank you.
Lee.
I kind of still back on the water issue with the schools, which leads me to believe that we have some entities out there that aren't necessarily on public water systems. But looking at, you mentioned 56 federally regulated water systems and 95, what was the other part?
Yep, let me find it. Federal, there's state and federal, and they are, we have 56 federally regulated water systems and 95 state-defined water systems.
My question is, do those systems contribute? Are there revenues that are realized through them? Is there an opportunity for cost sharing with the municipalities and the various entities out there that are required to provide water and provide it at a certain level?
That's a great question. I think the answer is no.
Yeah,
But
I mean, with that, there isn't currently, no. Doesn't mean there couldn't be a conversation, but there isn't.
Perhaps something to think about. But if they're in the business of providing the water and the county's in the business of being part of the regulations and working with them, perhaps we should be having that conversation a little bit somewhere.
yeah, certainly. And some of these, like in the two examples that I gave, you know, Caroline has their own well, and there's also several, like Enfield, I think perhaps Newfield also is not on, you know, a system of water, and they have their own water source. So I think that's another one where like it does feel like it's in our best interest to go out and really be checking on those. But yeah, I point well taken.
Thanks. Amanda.
Thank you. So every year, I very much enjoy looking at our contract list, and I always come up with very interesting things. So I have, if I can find them. So under Health Department, we have a contract with Jonathan Wood to do hearings, and I just didn't know what that was.
I also don't know what that one is. And
And
Jeremy may, and if we don't, we will get back to you.
Sure, and it's not a lot of money, it just was curious. And it's on two different lines with slightly different titles, so I don't know what that meant, but, so you can get back to me on that one.
Maury?
Right now.
And
Maury
then-
may have a comment.
I don't know the answer, but I could get that very readily for you. He serves as a hearing officer in some capacity, very rarely.
But
It's
health
a TUBA,
hearings?
and enforcement's
It's
from
in the
TUBA.
health department one.
Oh, okay.
It's a TUPA.
It sounds like it's, is that, yeah? So it sounds like it's around a TUPA, which is our Adolescent Tobacco Use Prevention Act.
Okay.
Which is an act that tries to monitor retail stores selling vapes to youth. around vaping. So I don't know specifically what role what part he plays in that, but we could get back to you with more.
It is occasional for those hearings,
Okay.
basically.
Okay, great. And then under the mental health department in the contract section, there's the contract with Catholic Charities. And the past 2 years, it's been around 30,000, and this year it's 455,000.
Oh, we talked about that one. Hold on. So this was around this came up at your last meeting. Sorry, this is a deep cut in my brain. What?
It's the opioid.
Yeah, this is it came through as opioid funding. It's a program that was run by us that is a housing first model for very intensive services. Okay. It actually, the city has contributed funds as well because they really liked the outcomes that we were seeing. And it is working with individuals who are living with significant mental illness and have not been able to have stabilized housing in other places. Either they've been kicked out because of property destruction or other things, and this is a intensive case wraparound with peer supports, with 24-hour staffing on site to help, and they have had really incredibly great success rates moving folks already into permanent housing. Yep, I think this is the one that I believe Deborah had asked about a couple of weeks ago.
We passed the resolution.
Oh, all right, well.
Yeah, and I can dig up more notes on that.
Not paying attention,
too.
but
no,
thank
that's
you.
okay. You may not have been here. It's all right.
Thank you.
Deborah?
Yeah, thank you. It's very nice to finally meet you. And I would give you an award as our most cheerful presenter so far. This is probably less of a question for you and more of a comment. And although the recommended budget doesn't support this request for certified peer positions, I'm not happy that this is an organization that, rather than making this request through the Human Services Coalition, seems to be making an end run around that process and going directly to you. So I don't know if you have anything to offer on that, Corsa.
I think the reason why we left it here was it was funded last year as multi-year program. So this is the second year of that funding. That is why we left. There were a couple of agencies that brought a request in that we refer them to specific department to where we refer them to HSC to submit an application through them. But we left this in here. So if you look at the enhancement number 1, is year 2 of 3 for the suicide prevention.
I'm talking about enhancement number 4.
Number 4, let me see here.
I understand about number 1, but
my understanding
Oh, okay.
is that this was gifted to us in our budget. It's not something that we sought out.
Oh, okay. Well, but
So
did they come
I
to
think
you?
it was
or?
no.
Oh, okay.
They did not come to us. I think they came to the legislature more broadly, and then it wasn't quite sure how to manage this request, so it was put in our budget.
Lucky you.
Veronica, did you have an explanation?
No, yes and no. I'm looking at the attached documentation you have. Norma, I saw you standing up, so if you have an explanation, I might end up asking you for that. And it says here, the request was made by a Tompkins County nonprofit, doesn't say which one, providing peer services to justice-involved individuals, but then it says more than one agency does this, and if this enhancement is approved by the legislature, the agency to receive the funds would be selected through a request for proposals by Tompkins County Whole Health.
Yeah, I read that too.
Well, I'm thinking that doesn't sound like the sort of thing that should go through the Human Services Coalition, because, I mean, I've never heard of RFPs going through the HSC. So I'm wondering if someone, I guess, can enlighten me on the HSC process and then also on this particular request.
Yeah, you're right, Veronica. That was exactly the case. So it did come to the Human Services Coalition, and it was referred back to the Whole Health Department because it's within their purview more than it is a Human Services Coalition type of work. So that's why, and this was through consultation, I mean, we had some conversations about this, but it also is one of those because of the type of service it is something that would have to go through an RFP process.
It still just seems like a workaround to me, and I'm not happy with it.
Okay.
Thank you.
Okay.
Well then, sorry, can I ask a question to Deborah, which is I know, sorry, this isn't for you. How would such a thing play out with the Human Services Coalition? If someone is coming and saying, hey, we have this need, we want you to fund it. It doesn't have to be our agency, though. We're not choosing which agency. Can you figure it out for us? Is that something the HSC staff can handle through the existing process?
I just don't think I like seeing it come in at budget. I think it should go through a program committee. If there's a need, come to a program committee, prove there's a need, have the legislature consider it. I don't like seeing it this way. I just think it's a workaround.
Okay, can I move on? Yes, Randy, you're next.
Thank you. Thank you for answering a lot of my questions already. And regarding water systems, Newfield does have a water system that serves numerous manufactured home parks as well as the hamlet, but it is from an aquifer well, numerous wells. So, and I do get notices in the mail once a year that they did this test and this is all the things and whether it met compliance. Is that actually come from Whole Health?
Yeah.
Okay.
Well, yes or maybe, I guess, is actually the right answer.
Right.
So, I mean, there are systems that do reports and then report to us, and then we watch their reports. We do try to annually go out and do a test ourselves. So I can't say if, like, the report you're getting may be some independent testing that they're doing, but we also would go out and do a test.
Okay. Yeah, I'd like your thoughts on that, by the way. And also you're doing testing on private systems like in manufactured home parks. And that's quite a risk for a lot of manufactured home parks because I've seen the stipulation agreements and whatnot that you have to go through for that. And it seems like sometimes you're really chasing the owners of those properties and spending a lot of money chasing for testing and I think that's where they should be paying part of that expense because it's important for a lot of these rural areas. I'm looking at 4016 community health, and I'm looking at your program expense, and it says professional services, which is 54442, and it says your budget for this year is 166,000, but you've only spent 10,000 so far this year. But your budget request for next year is 200,000. So is there something changing there? Or?
We're catching up to you.
Okay.
4662.
40. It's the professional services is 54442. And your budget for this year is 166, and next year 201,000. But you've only spent 10,000, roughly 11,000 so far this year.
Okay, so this is involving rabies, which we just got out of the season of, right? And so there is that delay right after the season. Or actually, we're still within that season as far as where we're paying it out. So a lot of that happens later in the year. So it doesn't happen, almost nothing happens in January because the rabies cases are not happening. And then the summer happens, we get all the information in, and then we spend the money. So we'll see at the end of the year, but that's primarily it.
And of course, the big question for me is your revenues. How are you feeling about your revenues? Are you going to meet your budget? And what are your thoughts on that? And a big concern is Shauna mentioned that it's good to get ahead of these revenues now as what's going on and all the changes, and it'd be nice to know, sooner rather than later on how those things are going.
Yes, totally agree. I mean, there's nothing we monitor quite as closely as revenues. So far we don't have information to say percentage of people that are going to change their insurance for sure, right? That's a missing piece. But as far as how much it went up, which is what we are benefiting from this year, that's really like 5 years worth of work kind of finally occurring. And you'll see us go over budget and revenue. We will exceed our budget and revenue this year. Really, this is the first year we've been able to realize the gains that we've been working toward through stability in our staff. When you have a stable staff, you're able to provide services at a rate that's more appropriate, and then you bring the services in for billing as well, rather than constantly turning staff over, retraining them, spending 6 months and essentially not bringing in any revenue in for 6 months. So as far as our staffing side, is a huge part of it. And then most of these salary increases have happened over the last 2 years. So these rate increases that keep going up and up, this year again is one of the first years we've been able to realize that. We've shifted a lot of our services towards schools too. And when you have to leave our building and go to the school, that rate goes up pretty significantly. It's better for the kids, but they're offsetting us, that travel and all of that. So as far as how confident I am in the current staff, the services they're providing, that the levels will at least stay where they are, if not increase next year, I'm very confident in that. Am I confident in how the shakeup will happen with insurance companies and the portion that is Medicaid? That's still fairly unknown. But there are other organizations whose Medicaid is up toward 85%, and we're at 65%. So again, we tried to take as much of that into account as possible, but we'll need to give you updates all throughout the year next year to make sure.
Appreciate that. Thank you.
And I think just worth mentioning too that, I think a lot of people think about the services we provide and they think about folks who are just living with significant mental illness, but that is just like a small portion, maybe not a small portion, but that is just a portion of the people who come in through our doors. We see anyone who might not be able to have, see a therapist or a counselor because it might be unaffordable for them and their private insurance, so they could come through, or we see families that are on Medicaid that have higher thresholds or in the essential plan that kind of come through. So I think in terms of our concern around the work requirement, I'm not quite as concerned, because I think we do see lots of folks who are families that are living stably, parents are working, and they just still happen to be on the Medicaid threshold, but they may still be eligible for Medicaid, and then, we'll still be able to bill for the services.
Great. Is the PROS program still part of your budget?
It is.
Yes.
Great, thank you.
And Corman.
Thank you, Jenny and Jeremy. So I had a question about the environmental health position that was not recommended. Just trying to look at the cost, the local cost for that. And so maybe this is for Norma also, but on this, the long sheets for the enhancements, it's totaled at, it looks like it's totaled at 98,000, but on your slide, I think it said 62,000, and I know you mentioned that part of it is reimbursed for part of that position, so I'm just trying to figure out what our local share would be if we funded that.
Yeah, so the local share would be 62,789, and the state aid share would be 35,000.
62,789.
Yep.
Okay. That's the person that would work with water and other issues.
Yeah, and I think I will note, and I was sort of chit-chatting with Shauna before we started, our environmental health team, all of our teams are really remarkable. Our environmental health team is remarkable in that they are very flexible and adaptable, and they are able to wear different hats really quickly. So also by sort of staffing up with another water person, it frees up the person who's doing water right now might be doing water. They might also be doing other things. So like by adding another water staff, it frees up more staff time for our other work, for rabies, for our food service, for monitoring for a TUPA, enforcement violations, for restaurant work. They really are very, they're very cross-trained, and they work in a lot of different spaces and areas. So kind of increasing the space for someone to focus on water frees up the people who right now are trying to do water plus parts of their other jobs to go just do their other jobs, which also helps us in a host of other areas.
Years ago, I was at living at a multi-family unit. I don't know if there's 4 or 6 units in it, and the landlord was providing the water, well water, and it wasn't until everybody was getting sick that we had complained to the health department. Then the health department came in and had found some major issues with the water, but it wasn't. They were supposed to be doing things, but there was nobody really coming in to regulate that, to check that they were doing what they were supposed to be doing. So, thank you.
Yeah, thank you.
I wanted to ask, not so much about the budget, but something that concerns, I think, all of us, is recent news coming out of Washington about vaccines. What is the state doing? What's the recommendations? how do we make sure that people get the right information and are not just going to not, for example, have their children vaccinated because of rumor?
Yeah, thank you. It's nice to talk about content for a moment and not just the budget. So I think it's really important to me to be able to respond quickly with the information that we have and say what we know and say what we don't know. And so our team was really quick when there was all of the back and forth federally around the COVID vaccine. Is there going to be a prescription? Is there not going to be a prescription? To really share what we knew immediately right away on our website and be clear about what we didn't know. And then as soon as we learned more information, we updated that really quickly, and we quickly drafted an FAQ, which I shared with you all, that sort of addressed people's most common questions around it. We've also leaned heavily into, association groups and other providers and practitioners that we think are sharing information that is accurate, and sort of quickly reflecting what is also coming out of New York State that we think is accurate and appropriate information to be sharing. So, for example, in regards to the president's recent press conference around the use of Tylenol in pregnancy, which is something that I do not believe to be scientific or sound advice. We very quickly pivoted and looked for resources from ACOG, which is the American College of Obstetricians and Gynecologists, and then also to the state commissioner, James McDonald, and we have sort of used some of their materials that they have been sharing for our own purposes to sort of share out what we believe to be accurate, scientific, and credible information.
That's great to hear. I don't think any of us were not totally proud of our whole health department during the COVID epidemic and how it was a leader in the whole region and in the state. And I'm sure that you folks will continue to live up to that great model.
Thank you. I hear from our staff all the time when I ask them what they're proud of. That still is something that they talk about, how proud they are of the work that they did and how they could serve the community. And I think that really drives them, all the time and all of the things that we do to sort of live up to that model of expectation and really be here in public service. And that's the role that we all have.
Thank you very much. And thank you for your presentation to everybody tonight. It helps us to understand the whole budget process.
Thank you.
Our next department is assessment. Jay Franklin, our director, and Irene Keogh, and Tammy Van Orman.
Good evening, everyone. Sorry I couldn't be there tonight, but unfortunately I'm at one of my other positions. Hopefully everyone can see this here.
Yes.
Perfect. Come on, there we go. All right, here's our 2026 budget presentation. Our lovely Annex Building C. Here's our department purpose. Really mainly our mission is to maintain an equitable and accurate market-driven property assessments on a yearly basis for real property tax administration. And we're here to really distribute that tax burden. We don't create a tax burden. We don't have spending decisions, but we just make sure that all of the properties pay their fair share of the spending decisions by the taxing jurisdictions. Here's our FTE. We're looking to stay level from 25 to 26. As some of you have been on this for a while, I always like to we used to have 19 people in my office back in 2000. We dipped to a low of 10, and right now we're kind of leveled off at 14.2. Our budget snapshot, this is really a maintenance of effort budget. We don't spend a whole lot of money. We have no new initiatives except for the conversion to the new Tyler technology database that New York State has awarded us an LGE grant for. So a big thank you for Bridget for pushing this through. And, this is $324,000, I believe, coming in to pay for the conversion and all of the costs associated during that first year. The nice thing about that is now that it's kind of cost neutral for the county, I'll be looking at a couple of new modules a little bit earlier than what I anticipated to see if we can bring on in 2027 when we go live with that database. Besides our database contractual expenses and our image made online, we only spend, a little over $53,000, right, generating $62,000 in revenue. We don't spend money. Irene and I are both cheap. If you come over to our office, we've created offices with filing cabinets, piecing together whatever we can to try to make it work. If we can reuse something, we're going to use it before we spend it. We've never replaced our carpeting in our office since our office was remodeled in '98. It's just what it is, but we get by. Here's the maintenance of effort budget. So we have the CAMA, computer assisted mass appraisal software. We're in year 2 of our conversion. That's fully supported. The law books that I utilize and the inserts has increased pretty significantly. So that's the $1,250 expense. One thing that was not supported was a little more money for us to go to the user conferences in the for our new database. So that's fine for 2026, but it's probably something we should try to build in for 2027. And then a small increase in our licensing fee to Schneider Geospatial, which is now our new assessment database. And if you haven't looked at our new Beacon product, it's great. We're getting a lot of positive reviews, and we're going to be setting up some user groups with a couple realtors, lawyers, towns as time moves on, and we have the time to do so. Enhancements, we have none. We're plugging along and doing our same thing that we've always done. But we do have a couple reductions that the county administrator made, as I mentioned, that $5,000. Some reduction in our computer equipment, so we won't be able to purchase any automated measuring devices, new digital cameras, things like that. So again, that would be something we would be looking to try to expand in 2027. We did have money in for new office furnishing, not quite realizing where we're going. But with the furnishing that we got in Dutch Mill, the furnishing that we can bring from our office, we'll make it work for 2026. It's not anything that is outlandish. So, I'm not here to say we need that $11,100 that was removed from our budget. We're more than happy to put that towards the cost. And that's it. I'm almost embarrassed to be so quick after the last 2 presentations, but we really have a pretty basic budget.
Well,
We appreciate you, Jay.
Yeah, don't be embarrassed at all. We're glad to move right along and glad to have all of you here tonight to help us. We have some questions. Randy Brown first.
Yeah, thanks, Jay and Irene. This isn't a budget question, but so next year you're not planning to renew assessments in 2026? You're going to leave them kind of where they are, and then 2027 you would start up again? What's the plan?
Yeah, so we just submitted a budget or an item for it to come to GO next week. We'll be putting a pause on really market-based changes through 2029. So I don't want to steal all my thunder from next Thursday, but essentially we need to put all of our time and effort into the Tyler conversion. Every conversion I've heard from Tyler, it's only as good as the amount of time and effort that you put in to make sure that it works. So this is a huge investment, and this is very important to me to move to this database. It's something I've wanted to do for 10 years. Tyler is the industry leader, and this is going to allow us to really interact better with the public than what we currently do. So we can't make 25,000 changes in assessment and be able to dedicate our resources to this conversion. So we'll go live in July 1 of 2027. then we really have had 3 years of not maintaining market-based assessments or full value market-based assessments. In our prior years, it's always taken us 2 years to be able to revalue the county. So when we go live July 1 of 27, then we'll start for a revaluation that'll then be completed for the 2029 assessment.
That makes a lot of sense. Garbage in, garbage out. So thank you.
What? Okay. Anyone else? Veronica.
Jay, thanks for the very crisp presentation. And the 2 previous departments are also our biggest budgets. So I would hope I would hope you wouldn't be as long. About the assessment process, I'm curious in terms of like both how this impacts like the workload and the cost for your department, and also, sorry, I'm not phrasing the question right. When we think about your assessment process, I think that I know I and many of us are thinking about how it applies to residential properties, like people's houses, because that's what we hear from. But I know that the method for commercial properties is different. And I'm wondering if, like, when you're pausing market-based assessments for the few years, does that impact commercial properties in a similar way? And also, is there a difference, like when you're going out and doing the work of a full reassessment, is there a difference in the workload per property or per value on average for residential versus commercial, if you know?
So there's no difference between residential and commercial. We're still trying to get to the same answer. What is the market value of that property? What is the most probable selling price between a willing buyer, willing seller, acting with undue influence, and have the transaction in terms of dollars? So there really is no difference. So in terms of a pause, there's going to be no difference between commercial or residential properties. We will still pick up any physical changes, new constructions, demolitions, parcel splits, parcel consolidations. So it's not like we're not going to be doing anything. And this is also a good pause in that, I have a pretty young staff, and all they really know is going out and maintaining full value assessments. So that's 6 months out of the year that they haven't been in our office to learn everything else that we do. Bless you. All of that, so there's a lot of work that my office does that isn't just changing assessments. We process exemptions, we maintain tax maps. We're also, unfortunately, the entity that has to verify special districts. So we're trying to figure out where a lighting district is located that was formed in 1937 with no formation documents. So there's a lot of research that goes into a lot of this work, and a lot of this had to go on the back burner as we were making those changes. So, this is a good pause for us. Catch our breath, pick up a lot of that work that we had to push off that wasn't as important as the assessment changes, so that when we do come out in 2029, we can come out with a good roll. Now I wouldn't say there's any more work that was done or needs to be done during a reval than an annual job. It's just we're going to be looking at everything, not just what needs to be looked at. Typically we do a statistical analysis based upon our sales, our assessments, and let the numbers let us know what we need to revalue for the upcoming year. This way we're going to look at everything from exempt properties to ceiling railroads to utilities to everything.
Okay.
That's helpful, thank you.
I have Shauna next.
Thank you. I think some of the information that I've received back from my my neighbors and constituents, Jay, is that there's a bit of disappointment because many people were reassessed in the past 2 years, and the 1 year that it seems like you're not reassessing is perhaps a really low year. And we're seeing properties that are sitting on our block. We're seeing properties that are being reduced, and that's some of the chatter that's happening in the Northeast area, is that the market's not as hot as it once was. And so why aren't we being assessed based on the actual demand of properties? So just.
Yeah, I mean, the market is still increasing. Properties are still selling for more what our assessments were. So if we were to continue to do full value assessments for 2026, you could expect 20,000 increases in assessment. So they may be reduced from their listing, but we're still seeing property. Irene can speak more from this because she reads every deed that comes through and verifies all of our sales, but the market's still strong here.
I think it would be great to send that message out because I think that seems to be some of the chatter we're hearing in our districts.
Yeah, and that's one thing, we can't assess properties above 100% of their fair market value. So if the market were to decrease within this time, I'll do anything I could possibly can to reduce assessments. That would be great to be out in the front of the Ithaca Parade. Jay finally reduced assessments like he always said he was going to do, but we never believed him. So, it doesn't matter where assessments go, whether they go up, whether they go down. What really matters is the spending decisions that you're making tonight and the towns are starting to do. We could cut assessments in half, but if the budget goes up 10%, hey, guess what? Your tax bill's going up 10%, even though we dropped your assessment 50%.
Thank you.
Ann?
Thank you for the presentation, Jay and Irene. So something I've asked before, for commercial assessments, I personally would like to see us get information on how our decisions here affect the tax rate of commercial properties, whether it's stores, other businesses.
Do you mean rate or do you mean
I'm sorry.
Do you mean rate or bill?
Either one, the rate or the bill. I mean, because we get information about how our decisions affect the median household, but we really don't get a lot of information on how commercial properties are affected, whether it's, off-campus fraternities. I mean, we just don't get any of that information that I know of.
Yeah. I worked with Dom this year for the city's budget to kind of come up with a couple different personas. I think there was Tenant Terry or somebody like that. He kind of created these different personas of rental properties, a tenant in a strip mall, and how the city's budget would be affected. So I think that's something that I can work with Norma on to say, hey, take a look at these different personas and what's happened to them over the years. And it kind of painted a decent picture, I think.
Yeah, I know for me that would be helpful. Thank you.
Yeah.
Anyone else? Jay, Irene, and everyone, thank you so much. We appreciate the presentation tonight, and especially not asking for more money.
Oh, no problem. And we're even giving you more money with that LGE grant. So thank Bridget for that.
Thank you.
Well, always grateful.
All right. Take care. Have a great night, everyone.
Tompkins County Public Library.
Getting any information on that.
We have Susan Curry, who's familiar to all of us, and also Liz Chabot.
Hi, everyone.
Hi, Susan.
Hi, Susan.
I don't know if you guys ever saw the movie Groundhog Day.
Yeah, we saw it again. Yeah.
Each time, each day, you learn something a little new, and then there's something familiar. So it's been a really interesting experience, I'll just say. It's fantastic. It's the best library in the world.
Yay.
Yeah. I want to thank a bunch of people. First, I want to thank the legislature because you had the special committee to invite the community to serve as trustees. We have fantastic trustees, chose well. They really revitalized the board. I want to also thank, Sarah Glagowski and all of Finger Lakes for working with us so closely. I want to thank the Board of Trustees. I have Liz Chabot, who's our board treasurer, with me. And we also have some of the staff here tonight. Thank you so much for coming. It's been a really wonderful experience to go back, although it feels like it just started a minute ago. But I started actually April 1st, and no one made any comments about that. I wanted to thank county facilities as well because we spent a lot of time trying to figure out how to open the circulation desk. County facilities, and particularly the county electrician, Mike, spent a lot of time with us. I know that they are very, very busy. They came through the contractor to look at fixing up the outside of the library. We do get quite a bit of comment about that. And we're very appreciative of how much facilities has to do. And we thank them for all their support. I have to tell you, we hear constantly every day how happy everybody is about the circulation desk. They're glad to see people. And all of the staff have embraced reopening and restoring programming. And we have a really wonderful staff, and they're fantastic. Next slide. As you remember, I'm very extroverted, so I'm trying to make myself look at my script instead of just telling you every single minute of every wonderful day. One of the most important things is libraries contribute to the economic, cultural, and educational well-being of our county. I see this on a daily basis. They provide free and equal access to both print and digital collections. We provide resources for job seekers. We are often, for people, the only place they can access the internet. We help people with test proctoring for either to further their careers or for their education. We have an enormous homeschool population that we serve. Community members rely on the library for assistance accessing e-government resources. Tax season is a particularly bad time. We also, we heard a lot about volunteers, and I'm happy to say that we have a new volunteer program called Program Partners, and you can see there's an announcement that just went out about that. So we're excited about that. We also collaborate with dozens and dozens of organizations and county agencies to present programs for educational and social issues. In addition, we serve as the central library to the Finger Lakes Library System, which serves 33 libraries in 5 counties. And I think we all heard about that quite a bit earlier this year. We also support all of our Tompkins County rural libraries, and we provide support to the community reading centers, if you're aware of that, and Enfield, Danby, and Caroline. One of the things I always say is a library is an excellent example of a cooperative purchasing system because we leverage public funding to ensure equal access to information in all formats. And we have on our website, we just put it back up. We used to have it years ago, a library value calculator. And what you can do is you can use this to see how much money you save by using the library. Next slide. I'm supposed to have 15 minutes. I'm going to try to stay on that. So just to review, our revenue comes mainly from the county, but we do also get revenue from the town of Ithaca and from the city of Ithaca, and we've made requests to both of those entities this year, again, for programming. We also receive funding from the Friends, which primarily supports, it is the primary support for the collection, and the TCPL Foundation. The New York State aid that you see on the chart is what we receive through as a central library from New York State. The budget request from the county is almost entirely about the staff that keeps the place running. Next slide. And our budget expenses, the majority of the expenses for the library is the staff. But without the staff, you really just have a building with books in it. The staff are what provide the services. They purchase the books. They process the books on all of the digital content. They make that accessible. They also provide all of the programming, and they maintain the collection as well. Library workers they play a crucial role in fostering equity by actively working to dismantle barriers and create spaces that are accessible, welcoming, and beneficial for all. The budget request from the county that we ask for every year is primarily about the staff that keeps the library open, orders and makes available all of the collections and the programming. Next slide. So I just want to remind people about the maintenance of effort. I think you're all aware of this, but I always think it's really important. It is a legal binding that the legislature has. The budget for the Central Library can never fall below 95% of the average of the previous 2 years. It sets off a chain reaction for the Central Library system that would have an impact on the 33 libraries. And we have been able to have that maintenance of effort, so thank you. Next slide. Our maintenance of, our FTE report. I think I'm missing a slide here. I'm missing a slide with budget snapshot pressure points. It is okay. Don't worry about it. I'm going to tell you what the pressure points are anyway. So the library does have some pressure points. I have 5 listed here. And these are all things that the library must pay for, and we're not requesting any funding for this. We will use the library's healthy fund balance for this. The first one is the security. The county did give money for security in the past, which was very helpful, but of course their prices increase every year. So Amrex Security is a very good company, and I will note that there's been an increase in incidents overall downtown, as you're probably aware. But the guards are very good. They treat everyone with respect and courtesy. They work with the police department. They work with REACH. They work with other organizations as needed. Recently, the Downtown Ithaca Alliance invited the library to participate in their planning for emergency communications when emergencies such as the recent fires in Asteri happened. So we're working with them. The second thing is that the library has always been a certified living wage employer. We think that's a very important way to support our employees, and we're happy to say that we will do that again this year. The board just recently voted to approve the current living wage for all of our employees. Contract negotiations are currently underway, and that will certainly have an impact on the library budget. We don't know what the result of that will be. The computers in the library, all areas of the library for the public and for the staff, are in need of replacement. They're very out of date. We've been working with the company that provides technology called Synergy, and we have a replacement plan that will take place in October. The computers were on a rotating cycle, but then the pandemic upended that, and then the changes in leadership there. So we're at a pivotal point where it has to be done now. And lastly, staffing has decreased to an all-time low, causing issues with ordering and processing the collections that are in demand. As I said, I'm not asking for funding for all of these things. And if you're interested in the amounts for these, I have them. Maybe I'll put them up here, but significant. Okay, now we can go to the next one. Thank you. Go back to the one about FTE. That's it. Thank you. I want to just talk about library staffing. I would just note that the library, I think I mentioned that the library staff is at an all-time low. I was shocked at the number of staff. There have been a lot of vacancies over the past 2 years. And the staffing has been changed significantly since the pandemic. So I went back. This is my 3rd time to be the library director. I went back to help open after the pandemic, and there was a set of staffing, and that is a greatly reduced number now. So just during the pandemic, there was the elimination of an entire department, a department head, and 5 positions with the work distributed in our adult services staff. That's where it is now. And this was a department to ensure that we were ordering, processing, and making available all of the collections. And the collections has been a big issue, so that's of concern to me going back. We currently only have 3 staff ordering and receiving physical collection materials as we work with Finger Lakes on restoring the collection. The purchase and processing of digital is shared among all the staff, a little bit easier. Where possible, we're using existing vacancies to fill these positions. The other thing is we just lost our business manager, so we're looking to hire that. So there are a number of positions to fill. So I am asking for an over-target request, and you can go to the next slide. And that over-target request is for a clerk and a senior clerk, specifically to help with ordering and purchasing the materials. We have some of the staff who are here are some of the staff who do some of that ordering and also who do the shelving. And I'm a little worried about the staff that do the shelving and processing because they're pretty tight at this point. At any rate, I want to say I'm very grateful for the recommended budget for 2026. And with the renewed focus on the collections, I want to emphasize again that we need to establish a unit to deal with this. So every staff who works in the library works at the service desk, which I think is good because that way they interact with the public and realize what the public wants. So that is my budget presentation, although I hope that you will ask me questions so that I can share with you more about what the library is doing. And thank you for allowing me to represent the library.
Thank you. Let's have questions. I saw Dan first, then Amanda.
Hi, Susan. You just said you're requesting $96,570 for a staff person, but in our books and elsewhere it says $200,000.
That was the original budget that we sent over back in at the budget request. But when, preparing for this presentation, I looked at that and I looked at what was the real need. And I think that was not an accurate amount. What we really need is the 2 staff positions.
Okay, $96,570 is 2 staff positions?
Mm-hmm. It's a clerk and a senior clerk.
Gotcha. And
I forgot about that 200,000. I do remember when that was entered. But we also were, I think that was my first month there. The budget manager and I were struggling to figure out what exactly do we need. And at that point, when I started at the library, there was a great amount of upheaval and change. And so it took a little while for things to settle down. But I can't in good conscience ask for 200,000 if I know that I think that we could do. I think we would be okay with the budget that you have offered if we did have those 2 positions.
And then also in that earlier request, it was $12,000 to restore the 2025 cuts?
Actually, we had asked for last year there was a $20,000 cut that was distributed to the rural libraries. I think that's where that came from. But I see that the 20,000 has been restored, so we're not asking for that.
So that's your entire extra request?
Yep,
Thank you.
that's it.
Thank you.
Amanda.
Yeah, I had a similar question, but hi.
Hi.
Nice to have you back at the table. Thanks, Liz, for coming. And I had similar questions, but I was also going to ask something else. I can't remember what it was. But how much longer does the library have you for?
My original appointment was for 6 months, which would be September 30th. Okay. But we have some turnover, and a very important position is that business manager position. So we just went through the interview and hiring process, and we'll start to onboard that person next week. So I offered to stay till at least October 10th to give that person a couple of weeks. So it's hard to let go, but I will say my family is asking me to.
Yeah. Well, thank you for everything you've done. And unfortunately, you left us here, but we have your lovely replacement.
It's a good seat.
Yeah. But thanks for all the work kind of getting everything back on track.
I will say, as I said earlier, the board, the staff, Finger Lakes, everybody has really pulled together. The community has been very responsive. We hear constantly, the staff it's nice for the staff at the circulation desk to hear the nice comments about reopening. And if you haven't seen, we have this amazing new program about the Constitution. It was incredible. So I would encourage everybody to come to that. It's once a month.
Let's see, we've got Shauna next.
Thank you. I had a question in regards to the positions that you're asking for. I personally am apprehensive about adding positions because it means that we're essentially committing to you for many future years because we want to keep that person employed. If we were to add one position or provide the funding, would the library work hard to backfill that for future years, or would you expect the county to pick up the tab for that in future years?
Well, that's a good question. So you mean give us one-time funding?
Yes.
That's hard.
Okay.
Because
It's hard to get somebody to take the job.
yeah, it is.
Is there a revenue source that you could tap into if you were given a year to find the money to pay for the position?
There are no revenue sources for a library, unfortunately. I mean, even if we
We
weren't-
only spend money.
Sorry. I mean, a library is...
Like my daughter.
I think a library is not a revenue-generating resource. But what I would just repeat is, and this is something people don't think of, is that, as I said, a library is an amazing cooperative purchasing agreement. So if you give us a clerk, we leverage that millions of dollars more because we make so many more materials available. So instead of everybody having to go out and buy one book, we buy one book that can be used by millions of people. So the cost savings for that is pretty amazing.
Thank you.
I do remember being on the other side and how tight the budgets were. So I'm not asking for a lot, but we are working to use the positions that we have, the vacant positions that we have. But my assessment has been that we have not had an adequate unit to order and process the materials to make them available for the collection.
Randy.
Thanks, Susan. I've heard from two different parents that they feel good about bringing their kids there, that they maybe didn't feel as good about it in the past, so just wanted to share that.
Great.
And that they don't have problem leaving them there and wandering around themselves, so that's, I think that's good. I'm a little disappointed we didn't get around to fixing the outside of the library this year. And I'm not real thrilled with how it looks.
Yeah.
It doesn't seem welcoming to me, the library, the way it looks.
The outside?
And is there any idea that where any murals might be a good idea? I mean, so that's one of the thoughts I had, it'd be a good spot for murals to kind of clean it up, make it look better, and since we're going to be doing painting anyways, so.
I think that material is an odd material. It's not a smooth material, so it might make it hard. The other thing is because the library really should be a neutral place. I think having it not have murals might be better for the communities rather than choosing murals that represent something. It's because it's open to all. But I will say, you know, Aurel was wonderful. He spent a lot of time talking to us about, he understands the need. I know that facilities is just really stretched thin. And we do tell patrons that they absolutely are planning to come and take care of it. They did take down the little flags that were outside. They were going to try to power wash them. I don't know what happened with those. But they will do it. They have always been very good about maintaining the library. The inside of the library looks fantastic.
It does, looks great.
Yeah, they do a great job at that. It's the outside, but it's wearing over time. And the old solar panels, we used to have used to be able to go to a website on the library website and find out how much solar power. Well, we took that down because trees are growing in those solar panels on top of the library roof. So yeah, there's definitely a need for some maintenance of that.
Yeah, I would say we are celebrating 25 years on Green Street, so the building just has, I think, a natural cycle of needing to be, certainly the outside, refurbished and refreshed.
Right, and that's one of the things I wanted to, before leaving, is to invite you all to it's November 8th. It's the 25 years on Green Street, and hoping that you'll come.
We actually talked about the roof of the library at a recent meeting, and it does need to be replaced in the next 5 years, so that's being planned. So, and the solar panels would have to be removed and whatnot. And I think there was actually a lease on them that if we wait a certain amount of years, the company that we got the solar panels from, it would be at their expense to remove them and to recycle them or however they do that. In your budget for 2025, I think you showed that you used 8% of your fund balance. Is that
It's a
correct?
hefty fund balance, that's why is that what you're referring?
Yeah, I think in the budget showed that you had to go to your fund balance to.
So we are going to use that fund balance for those things that I listed. We're not asking the county for that because we realize that we have a hefty fund balance. So that was, as I said, the living wage, I'd have to look at my list, but the list that I spoke about. Do you want me to go back over it?
No, I remember. I just wanted to.
Okay. Yes, we are using the fund balance. And I remember that, I know how you are about fund balances.
Yeah, I would like to know what your fund balance is. That was my next question. But you can send that to us.
Yeah.
So
Our goal with the fund balance is to cover non-recurring costs,
Yes.
capital projects, one-time things. So we're not going to commit the fund balance funds to things that escalate or, such as wages, et cetera.
And we can't use it for ongoing, it would be sort of like what you were talking about, but it's not sustainable, so we use it for those big expenses that we must do, like all of the replacement of all of the computers is a hefty amount. It's spending, we're going to spend it down.
I understand.
Just saying.
And has your 2024 audit been completed?
Yes.
Okay,
But
so I'd like to get a
there was a special audit as well, and we haven't seen that yet.
Okay.
Yeah,
So I'd
but
like to.
the regular audit was fine.
Okay. And then how's your collection? Are you putting enough money towards your new?
Yes.
Reinstalling all your collection and?
Yes, that's with the help of Finger Lakes. We've had several meetings with, the library actually did fail maintenance of effort in 2022. It was due to the pandemic. And so it failed maintenance of effort and New York State cut the funding. But once they realized that it wasn't punitive, it was because of the pandemic, the money was restored. And so that funding is coming through now. And so we're using that to restore the collection. And the librarians are working very hard on that. Everybody is, as a matter of fact. Yeah.
Okay. Thank you.
Ann.
Thank you. Good to see you, Susan.
Good to see you.
And so one question regarding the enhancement you asked for the 2 staff. So that was 96 something for 2 people. Could you don't have to do it right now, but could you send that to the legislature of breaking down? Because you said 1 position and then one was a
There's
senior
2 positions,
position.
yeah.
So I'm assuming it's not just cut in half. So if you could send us what each position would be out of that. Thank you.
Okay. Yes, there's a senior clerk and a library clerk. And they have responsibilities for, as the books are ordered, once they come in, they have to be cataloged and processed and put in the shelves. But I'll send that to you.
Thank you.
Shauna.
Yeah, that was my question, as well as if you had to decide between the 2 positions, which one would you want?
Oh, no, I'm looking over at Shelby. Helping us right now. So Shelby went from another, sorry to put you on the spot, Shelby, I apologize. But we asked the staff if there was someone in another department who could come and help temporarily. She volunteered. So, yeah, think about it.
Let us know in the email that you send.
I will, I can send you more information. And if anyone would like a tour, Greg came for a tour. No, he's not here now, but he came for a tour. And yeah, so if you haven't been in the makerspace, you have to come see it. I mean, it's pretty amazing.
Veronica.
I guess 3 things. One, is that $90-some thousand the total cost for 2 full positions? Because it just seems low.
It is low. Library staff are not paid tremendous amount of money.
Okay.
Clerk and yeah.
Yeah. I'm sorry.
Okay, they're amazing.
Yeah. Second, I had a constituent ask me to ask if someone could power wash the outside of the library. I know you're all talking about it.
Well, we asked that. Well, I did ask Arel about that. That material is so funny. In 2000, it looks so modern and new. It's 25 years later. That material is kind of like a weird, it almost is like concrete suede. I don't know what power washing would do to it. I think it might destroy it, but I can ask.
Great, thank you. I'd never thought that much about the material before. And then just, can you tell us more about the makerspace?
The makerspace is, yes, it was part of the 2015-2017 campaign, and actually Assemblywoman Barbara Lifton helped us with that as well. The makerspace is, most people tend to think of it in terms of technology, but it's every kind of maker materials that you might want. So we have a staff member who helps people learn to mend. We have sewing machines that you can check out. There's a laser printer that you can use. There's actually a very old-fashioned book press, if you want to make a book. It's very cool. And the 3D printer, if you go into the makerspace, there's a big chart that tells you all of the unusual things that have been made with the 3D printers. And one of them was a student, I think it was at the high school, had to do a science project and made a prosthetic hand that he could operate. It's very cool. And then people do something like someone had an old typewriter. It was missing a part, and they had there were two parts. They had one but not the other. They took the one part that they had, and they used the 3D printer to create a new part. So people are very creative with the 3D printers. And it's an interesting thing to go back, because when I left, it was first open and we had these big bulky 3D printers. And now it's so sleek and they're small and they're very, it's very cool. So it's a room where you can do from hands-on old-fashioned crafts to the high-end scientific. There's a lot of STEM programs there with schools and organizations, so it's really fun. We could have a class there for the legislature.
All right. I had a question. You mentioned those various items to be paid for that were non-recurring from the fund balance, but I think you mentioned the living wage. How is that non-recurring?
I'm talking about the retroactive, because the living wage was passed earlier this year, and so the board just passed the amendment to pay everybody retroactively back to the beginning of the living wage for this year.
Okay, I understand.
So that is a one-time. It is now in their salaries.
All right, that explained it. Thank you. Mm-hmm. Anyone else? Thank you both. Thank you everybody that came tonight from the library and Finger Lakes. We appreciate it.
I kind of don't want to leave. Thank you very much. It's nice to see you all. Thank you, Dan.
Yeah. Thanks for coming. I think before we start with TC3, we ought to take our break, our 10-minute break, and then come back. I don't want to go too long without that and go into a long presentation. So let's take 10 minutes and come back at 20 after. Okay, we're back. Let's take our seats, folks. Ann, take your seats, please.
To the board, yeah, I don't know if, should they?
You ready to go?
Our next presentation will be from Tompkins Cortland Community College. And we have President Kramenek here, along with Dennis Benedictis. And you're ready? We're ready to hear from you.
All right. Thank you, Legislator Lane, and good evening, everyone. It's a pleasure.
Mention that Roxanne Buck is here, too, from the Board of Trustees.
Yes. So thank you for having us here tonight. I would like to also recognize our board members. We actually have 3 board members here with us tonight. First, our board chair, Judy Davison. Judy is also an alumna of TC3 and is an appointee from Cortland County. Behind her is Sue Dale Hall. Sue is a resident of Tompkins County and is a gubernatorial appointee from Tompkins County. And then to my left, Roxanne Buck, who is a appointee of Tompkins County and has been on the board since 1990. Wow. So yes, so Roxanne and Judy and Sue, I know are familiar faces to all of you. So thank you.
Glad to have everybody here.
Yes, thank you. We are pleased to be here tonight to present our budget for 2026. Just starting out with Tompkins Cortland Community College purpose. I know that you are all familiar with us as a college, but just as a reminder, we are part of the SUNY system. We are one of 30 community colleges across the state. We are accredited by the New York State Education Department and the Middle States Commission on Accreditation. We will be up, just as a side note, we will be up for our reaccreditation in 2026-27, so we are preparing for that. There are some of our most popular programs that we have listed, as well as you all know, we prepare students both for jobs and for transfer to four-year schools. Our fiscal model is that we are funded through a 3-way formula from our local sponsoring counties, which includes both Tompkins County as well as Cortland County, as you know, New York State, and then student tuition. Just to give you a picture of our FTE report, I did notice on some of the other reports that this was referencing employees. This for TC3 is representing our students. So full-time equivalent students, you can see some of the growth that we have had in recent years. Is 2019, prior to the pandemic, we were significantly larger, but we are growing once again, which we'll talk about here in just a moment. In terms of our enhancements, fall enrollment is up right now about 11%, including adult students. You probably read about the SUNY Reconnect program that offers free tuition for adults ages 25 to 55, and for us, 12 high-demand, high-wage, living wage jobs. And we have received about 400 applications for that program. About 200 adults chose to enroll. We anticipate that that will continue to grow in the spring as adult students, sometimes it takes a bit to get their lives together to go back to, or sometimes for the first time, go to college. This is driving a need for additional resources in terms of teaching. As you can imagine, as 11% growth in enrollment is significant. It's the highest for us in a decade, which generates a need for additional teaching resources. We do have a new strategic plan, and I'm really pleased and proud to say that our Board of Trustees approved that plan in June. This is the strategic plan that is the successor plan that was launched in December of 2019, which was probably the worst timing ever for a strategic plan if you think about what came right over the horizon. This is a 3-year strategic plan because the board and the college both felt that it's prudent given all the change that's happening in the world that we, along with others, are dealing with. We do have some significant needs in terms of compliance with cybersecurity. The college has made many investments with your support, as well as Cortland County and the state, to improve our cybersecurity, but it is constant. We have to be constantly vigilant. Grants are becoming more and more a part of our revenue picture, and so compliance with grants, as I'm sure you know, that it's not about just getting the grant, it's about being compliant with all of the requirements, and that includes grants that we are receiving from SUNY. There are certainly many policies that we are also required to comply with that continue to change and evolve. We have a need for deferred maintenance on our building and our campus. Our campus in Dryden is 50 years old. While we do our best to maintain it, it is showing its age, and certainly the infrastructure and the systems are something that we are constantly maintaining. We also have a new facilities master plan that will be considered by the board at their October meeting. In addition to that, we need a new enterprise resource planning system, or ERP, and a student information system. We currently work on a system called Power Campus, which is antiquated. It is something that there are only 2 community colleges across the state who are currently operating on Power Campus. We have been notified by the vendor that it is going into maintenance mode, and then it is going in end of life, and they anticipate that that will happen in the next 3 years. Once that happens, we will no longer have the ability to maintain it from a cybersecurity standpoint, which obviously puts all of our student data at risk. So our request, and I'm going to turn it over here in just a moment to Dennis, is for a 5% increase in the operating budget annual contribution. We greatly appreciate the support of the county over the years. We have had flat funding since 2019 from an operating standpoint, and so we are requesting $151,369, which would represent the share of Tompkins County, that would then need to be matched by Cortland County in proportion to the number of students that are served for each county. In addition to that, our capital needs, as I mentioned, primarily it's deferred maintenance, as well as the replacement of that ERP and student information system. Tompkins County's share would be $258,877. I did just receive notification from Cortland County, who is also meeting coincidentally tonight, that they have passed the capital budget this evening. So I wanted to share that. And just finally, in conclusion, to again thank you for your support throughout the years of the college. We strive to do good things for our students. I did pass around a hot off the press economic value sheet of TC3. This was just published in July, and you can see there at the bottom, this really is an investment in the community college. This was done by an outside economic impact firm, noting that for every dollar invested in TC3, our students gain $6.10 in lifetime earnings. For taxpayers, it's a $1.80 return for each dollar that they contribute. So we appreciate that. We think TC3 is a good investment, and again, we appreciate your support. So I'll turn it over to Dennis.
Hello. I will talk about the specifics of our request. We have, as you see, 3 particular projects that we're asking for your support. The top 2 are capital requests, capital projects for the year 2026. And the bottom one, the third one, is a 5% increase in operating budget, as we had planned before. I will talk about those in detail in a few minutes. I will start talking about the capital budget request. Cortland County updated TC3, and as the president just mentioned, they have voted for that they will contribute $152,039 for the 2026 capital improvements program. This includes our ERP system, and facilities improvements, such as the deferred maintenance plan that we have planned for next year. As you know, that the New York State, SUNY, is matching 1-for-1 the county's contribution, 50% from the state and 50% from the counties. In this table, you see here our capital plan project for the year 2026. On the top row, you see the deferred maintenance plan. The total amount is $521,000. $260,000 is going to come from SUNY. Tompkins is going to contribute, after you approve it, $164,000, and Cortland County, $96,000. This will materialize in summer of 2026. The second one is the updates on software, the enterprise resource planning system and student information system. This is going to be a 2 to 3 year project that will cost over $2 million. For this year, we're asking for $300,000 included in our capital projects. And this will be funded 50% by SUNY, $94,500 from Tompkins County, and $55,500 from Cortland County. And this will be taking place next summer as well, spring and summer. The total capital projects for 2026, it's $821,000. Tompkins County portion from that is $258,000. Last March and April, we put together our budget, and we included a 5% increase in operating budget contributions by the two sponsoring states. At the time, counties, I apologize. Cortland County at the time mentioned to us that they were not sure they could support that. So we had to finalize our budget without this 5% increase from the sponsor counties. We finalized the budget committing some additional efficiencies to balance our budget, and that's the one that has passed last summer. We need to verify today that Tompkins County can match what Cortland County has committed since, that they can increase the sponsor contribution by 5% or about $151,000. I have to remind you that both counties must participate for this increase in order to materialize. As you can see in this last table that I have here, the last change, the last increase that we received in operating support from the two counties came in the year 1920, so it's 6 years at the same level, and we're hoping to get this year a 5% increase. The total increase for the college will be $244,000. Tompkins County participating at $151,000, and Cortland County by about $92,000. You can see on the right-hand side the participation and the small increase in the last of, on the 7th year that we're hoping to get today. That's our presentation for today.
Okay, well, thank you for that. Let's take questions. Deborah Dawson.
Yeah, thank you. So I'm a little confused because in past years, we've approved your budget earlier in the year, and that just carries over into this process. And now you're coming to us, and the total that you're asking us for is $410,246. That's an awfully big bite. That's an entire 1% increase to our levy, practically. And I'm trying to understand why this year is so different.
So there's two requests. One is for the capital request that typically that has come at a different time because of the fiscal year of the college versus the fiscal year of the county. Cortland County had requested, as initially when we talked to them about the 5% increase, said that they were unable to support it. Since then, they had requested that we come back to them during their regular budget process to request the 5% operating increase. So now that they are willing to do so, we are coming back to this county to see if that is something that you are willing to do as well, or we will forego another year.
So what's more important to you? What's the most important ask in here? You've got $151,000 in an increase for operations, $94,500 for a capital project banner project, and $164,000 for deferred maintenance.
Yeah, so it's all important. It is all important to the college. I understand that. The student information system is absolutely critical. We cannot function without it. We also can't function being vulnerable to cyber attacks.
So that's the $94,500?
I'll ask you, Dennis.
The 94.5 is for the enterprise resource planning system.
Yeah, how does that fit into the priorities that Amy just described? Because I'm hearing different.
This is part of changing our software altogether, our college software.
So that's the essential piece.
It's all essential. That is absolutely critical.
Okay, thank you.
Dan Klein.
Yes, I just want to clarify, these 3 asks are not recommended, is that correct?
Yeah. Yes, so as I explained, by the time we got the request, we'll have already put everything together, so it came in as an additional. That's why they are not recommended. So there's a 5% increase. I think there was some degree of support for it during their budget period, but because Cortland was not doing the same thing, it didn't materialize. So now they are feeling that because Cortland is saying that we can support it, they want us to, if we can also support it. So that will be going back to their current budget as an adjustment to their budget.
Thank you.
Right.
Veronica.
Just to clarify, did you say that Cortland County approved, I heard they approved these 2 capital requests. Did they also approve the 5% operating?
They have not. They'll consider that next month.
Okay.
But the capital request has been approved.
Okay, great, thank you.
Shauna?
Yeah, that was one of my questions. I guess the thought of this is a little shocking because it would have been helpful if we would have heard it earlier in the year. It was somewhat unexpected. The question that I do have is, if we were to support these, Corsa, would you recommend, I mean, obviously the 5% increase for operations is going to be ongoing costs, so that will hit target. That will be target. For the others, would you recommend using one-time fund balance for these 2 projects?
Dan is smiling and looking at me because he's sat in this similar decision point before. I think based on what has been discussed with TC3 over time, these are critical projects, the cybersecurity as well as the enterprise resource program, which we are talking about it internally for a few years to come for us as well. So we would not object to it, but we need to make sure it fits within our financial provisions and where we sit at the moment. But it's difficult for me to say support it or not to support it at this point, but I will pivot the decision point to you guys and let you decide on that. Right?
Nicely done.
Randy.
Yes, on the sponsorship fund, is that if the county were to increase 5%, does the state also increase their percentage?
We would hope so, but it is not a 1-for-1 as it is for the 2 sponsoring counties. It is not the same.
Okay. And are you using any of your fund balance to balance your 2026 budget?
A minor amount, probably about $40,000, $35,000. We tried really hard to balance our budget this year and not use fund balance. This is the responsible thing to do at difficult financial times, so this is what we have been doing.
If I can just add to that, when I arrived at TC3, we had nearly a negative fund balance. That is not a fiscal prudent thing to do, and I'm certain no one would want to run their organization or their business with absolutely no savings account. So we have worked very, very hard to build a fund balance back to, what is the percentage, Dennis?
It's 5 to 15%.
Yeah, so we have a single-digit percentage on our fund balance, which still is insufficient for our needs. I need to be able to sleep at night and make sure that that we have a fund balance that would be prudent for an organization, so that we don't get into a situation like we did, as I understand it, many years ago.
I'm glad it's improved some.
It's improving.
Now, the county, Mike, you can maybe refresh my memory. The county had given some funds for deferred maintenance in 21, 22, 23, and we actually had a committee that was working in that for a while. Have we provided all those funds to you, or is the money sitting here, or how? Can't remember how did we give the money up front?
No, you provide,
Cortland
yes.
County kind of did it in kind with work and those kinds of things.
They did. So you did provide those funds to us, and we have made those investments in deferred maintenance. Cortland County had done in-kind services for concrete work. In the meantime, though, they were able to provide some cash assistance, which then allowed us to pay, for example, 2 of our parking lots that cost us $250,000.
This year.
Yeah, I knew they were expensive.
Yeah, they are extremely expensive.
If you could provide an update on just what the county has, what was completed with those funds, that'd be
Absolutely.
Sure.
Thank you.
Dan Nolan.
My question might be more for Daryl or Corsa, but so this 95K, give or take, in here, they say it's a capital project. That's not for inclusion in our capital plan, or is that a possibility for inclusion?
No, their capital plan is not included in ours.
No, I'm saying that isn't even a possibility on our end, right? Like, we are not allowed to issue debt to pay for something like that. That's what I thought. Okay, just wanted to clarify.
Yeah, this would be purely tax levy increase.
That's what I thought. Okay, there's terms being thrown around like capital. I just want to clarify.
Here's the problem I'm having. For 50 years, we've always recognized that TC3 is on a different budget schedule than the counties. We're on a calendar year, and you're on the state fiscal year. Normally, what happens, or used to happen, was we would get together with Cortland County, and we'd hear a presentation of the budget proposal, and Cortland and Tompkins legislators would come to some agreement about how they could increase the amount of the contribution from the sponsor counties. Whenever we did that, we had to take the risk because we hadn't got to our budget yet, and we simply had to say, yes, we understand that, but we're going to make the commitment now that we're going to fund it for whatever level they had agreed to. This year, Cortland did something different. They said, well, we can't agree to the 5%, which was requested by all of the college in your initial budget, because we don't know where we're going to be in the fall. And so, without their agreement to the 5% at that point, we couldn't agree to the 5%. And you folks had to readjust your budget, as Dennis has just said. I would be very worried that if we change the process here and decide whether that we're going to match or pay extra in the fall for the next year, it's going to basically throw a monkey wrench in our budget process for our county administrator and how that administrator will be able to calculate what we do. In the years that Cortland did not fund the additional increase, and I think it's been 4 years since we've been able to come to an agreement on that, we have tried to give some one-time funding for other things to the college here in Tompkins County. But I'm going to leave it at that, but I'm troubled, not by the college, but by our partner, and they're not willing to step up in the spring the way we normally do.
So we met with both counties in the spring. Dan and Corso were both in attendance for that meeting with the county. The counties at that time had, at least initially, indicated support. Cortland County later said that that was not something they were able to do due to the uncertainty, Mike, as you said. Now that they have stated that they can support us, we feel it's prudent on behalf of our students to come back and ask. I recognize the timing is an issue, and but appreciate the willingness of the legislature to hear our request.
Veronica.
Thank you for coming back and asking, by the way. If you don't ask, you don't get, even if sometimes you ask and you don't get. And I guess I acknowledge the difficulty, or, I don't know, but it must be difficult to have a bunch of your funding based on 2 different counties who don't really talk to each other, but somehow have to agree, and on a timeline that is totally not yours. Or you're trying to get us to agree on a timeline that's not ours. So then I guess a question about that is how, even in like a normal year when you are only coming to us in the spring and we in Cortland are making funding decisions in the spring, how exactly does that work? As like when are funds actually transferred? Because now I'm staring at our finance director, but from county accounts to TC3, and if amounts are changing, like at what point in the year does that change, given that the budget years are staggered? Does that make sense?
I think so. So TC3 submits a voucher very similar to what our departments do to Tompkins County, and then we process it as we would anything else and pay them, and it's done quarterly. Yes, it's done quarterly.
But it doesn't start till January probably, right? This allocation won't be paid to TC3 till January, correct?
Correct.
Correct. As soon as Dennis submits it, which would be next year, then it happens.
Okay, so that would be like if we approved this increase in this process now, then in January it would be the first time you got an increased allocation from us?
Correct.
Yeah. If we had been able to agree with Cortland to do a 5% increase back in the spring, then when would y'all have gotten the first increase amount? Okay.
Still in January.
Thank you. Wait, what? Oh.
Still in January.
No. Or yet, I heard September and January.
Yeah.
Budget year.
It's based on our budget year.
Yeah,
Right.
still in January.
Oh.
That's not how it works in the other county. I'll stand corrected on that.
Okay.
January.
I can look into it to verify, but I believe what we pay out, what you're approving on is our budget year.
Yep.
So it wouldn't start till next year.
The college's budget is September 1st to August 31st.
Okay.
And if it's quarterly, I presume then the payments are coming in quarterly, correct?
They're coming January, and we get our last payment for 4 quarters in August. So this is how it works usually.
With the 2 differing calendar years, it does get confusing. So I will look into it and get you guys a concrete answer.
But that's how it is.
Corso, you wanted to say something?
Yeah, I was just going back to Shauna's question earlier in terms of what we could potentially be recommending, and I've been thinking through it, and I think, as they indicated, they have been able to balance or get their budget approved and balance this cycle. So you can potentially look at the capital, because I think the enterprise resource is such a significant tool for them. And based on the fact that they're running currently on a very archaic system that need to be upgraded. And also, I think the deferred maintenance, we're facing the same crisis. As you push stuff back, they keep becoming more expensive. So probably the two capital projects could be considered if we can accommodate that. And maybe because there's a tentative agreement to increase the annual allocation, maybe that can be deferred to next year. And so that we can make that adjustment, provision for those adjustments.
If I can just add to clarify on the state contribution, on the capital side, the state does match 50%. So we have to have both counties and the state in order to access it. So if one of those three, or if either county declines, we're unable to access any of the state dollars.
Shauna.
So I just want to confirm that if you had to choose, you would prioritize the two capital projects over the 5%?
We must, well, given that we would then forego the state dollars, yes.
Despite the fact that 5% would be ongoing expenses year after year?
I'd like to reconsider, if the county would be willing, is to reconsider the 5% request consistent with the calendar that we have traditionally followed.
I'm confused.
What would that mean? I'm sorry, what does that mean?
So traditionally, the college comes to you in the summer with the budget that's been passed by the college's Board of Trustees. The timing of this is very different from that, clearly. With the college's budget process, we are starting that process right now for 26-27. We could come back again this summer if that's what the legislature would potentially entertain with a 5% increase at that point. We're just simply trying to, with Cortland County's willingness, is to see if there is an opportunity potentially to do something on a calendar year with the county. But if that is not possible, then we could move this forward with the board's approval to a summer 26 ask.
Okay.
So, but again, we haven't had an increase since 2019.
Anyone else? Thank you all.
Mike, can I just make a brief comment? On behalf of the Board of Trustees, I wanted to thank this group for all of your support for our trustees as we have navigated through some pretty tough issues with the state over the last year, and you all have been very helpful in that. And also just to note that at our recent conference, we gave an award to Steve Aquario for all of his efforts on our behalf as well. And I know you all, work with him as well. So he's been a tremendous help to our trustees organization this year. So just wanted to say thank you.
Thanks for that comment. All right, we appreciate your being here tonight.
Thank you.
Thanks.
Next presentation is TCAT. Matthew Rosenblum.
Thank you.
I'm dead.
Peace out.
Okay, good evening.
Good evening, thanks for coming.
No problem. Is there anything I need to do to present? I'm connected to the, shared my screen. I am not on the Zoom. Do I need to join the Zoom?
You need to get on the Zoom, yes.
Yeah, you got to get on the Zoom you have to join as a participant.
Yeah.
Okay, I don't know if I have the link.
Probably, hopefully got a calendar invite about it.
Okay, give me 1 second. I'm connecting to the Wi-Fi. Yes, I do have the link. I apologize.
Pass it around again. It's protein. Just take the whole thing, Lori. The whole thing.
We'll get there.
Yes.
Give me 1 second here.
Take it.
Need some address.
No, take the whole thing.
No, that's good.
Randy wants some. Yeah, he said he'd like some. Thank you. Okay, so. My husband.
Okay, I've got a flash drive.
This is what my husband says. I'm sorry.
Okay.
Oh, gosh, I don't want to know. Should have made cookies.
This is not my meeting.
Oh, yeah. Pizza means.
We're gonna eat the rest of it.
No, I don't. Mike's gonna eat the rest. I am too.
Another round.
Like you were looking faint up there. Glad you got the chocolate.
Many thanks.
Twist. All right, apologies. Zoom decided now was a great time to do an update, so we're just gonna have it on one of the county computers.
Yeah, I'm not against it. Or even, or whatever. I'm all for that. I don't think that's an all. There we go. I don't want to be the one. Someone needs to do it. I feel like I'm ready.
Oh, no, no.
All right, my Zoom is working now, so I can probably just run it.
Did it? Daryl did it. Oh, yeah, they definitely need it.
Okay.
Let's see behind me, Satan.
Chocolate.
Like I said.
What's that? I can, it's just joining now, so I can probably run it. All right, so I hit share screen.
No, they're fine.
All right, now you should be able to see my screen, right?
Wrong.
It says I am screen sharing.
It says you are.
That's what
I
it
wish.
says on there too.
There we go.
Okay, now we're ready. Apologies for the the technical difficulties. So, you know,
I think this meeting's over.
let's get to it. So thank you for having me tonight. I want to apologize. My presentation doesn't follow the county budget format because I didn't get the request until yesterday, and I was off. So we kind of took our underwriter's presentation and abbreviated it. So a little bit about, you know, TCAT, some of the things we've been up to this year. We have, let's see, is there a way to minimize all this stuff? There it goes. So we've had, we got 6 new battery electric buses in service, or we're in the process of getting them in service. 2 are through DOT, the other 4 are waiting on DOT inspection. That helps us with our moving towards a more carbon neutral goal for county residents, reducing noise, reducing tailpipe emissions. We are making a lot of progress on our IETA project, which will provide electric on-demand service to the west end of Ithaca. And we have just gotten through our 2025 triennial. There were 0 findings associated with TCAT, and a big thanks to Frank for all of his help. That would not have been possible without him and all of his hard work. So we're off to a pretty good start this year. As far as fiscal responsibility goes, we've signed a new advertising contract that will bring in a minimum cash projection of $1.1 million over 5 years. We've restored our service, and we've done a lot to improve service reliability. We've tried to rebuild faith in public transit, work towards ridership recovery and growth. We've reduced our reliance on outside contractors. That saves, we've saved 33% by decrease on our outside contracting expense by doing more things in-house as we've become more fully staffed with our in-house mechanics. We've brought our bus shelter maintenance in-house. That saves us $12,500 a year. We've saved about $50,000 as far as looking at redundant software. And we continue to have a better safety record, which helps offset insurance costs, which are a main driver of operational cost increases. So unfortunately, the current situation is we're at kind of an inflection point as far as our finances go. As I get into in this next part of the presentation, we've kind of been coasting on a lot of COVID era funding called CRISA and ARPA, and that funding has dried up. So in order to maintain current service levels in a period of rising operations costs, we are asking for an additional $500,000 per underwriter to help address that shortfall in our funding. We do have a budget gap. We're trying to address the budget gap early. The budget gap, you know, without an increase in the underwriter's share will continue to grow. And ultimately, if TCAT runs into a debt, the 3 underwriters, which as I'm sure everyone knows are Cornell, the city, and the county, actually have to pay off that debt. So we are trying to avoid a situation where we get a budget gap that becomes too large for us to address. And we're also trying to avoid the spiral of death in transit where cuts in service happen because there's cuts in funding. That means less ridership, which means less state funding, and it means less public support for transit. And then you have to do another round of service cuts and another round, and we're trying to avoid that. We realize the only way towards self-sufficiency is to rebuild ridership and gain stability. So ultimately, we have a situation where we have increased operational expenses. Going back prior to the pandemic, running transit was a lot cheaper. Labor was cheaper, tires were cheaper, fuel was cheaper, motor oil was cheaper, parts were cheaper, and everything's gotten extremely expensive. We've also fixed revenue. A lot of our riders are on limited incomes. State and federal funding has more or less remained flat, and this is creating a funding gap. You know, this combination of increased operational expenses and fixed revenue. Some of the COVID era, as I mentioned, we got $4.7 million from ARPA, $2.2 million from CRISA, and $6.9 million total of COVID era funding. And that's what we used to build our fund balance, and we used our fund balance to keep additional asks off of the underwriters during the COVID years. However, once this funding expires, we'll fall into a deficit. So state funding, we get the bread and butter of our funding is through a program called STOA, which is State Operating Assistance. STOA has been frozen at the 2019 level for quite some time, and that was due to the pandemic, but at some point it's going to be unfrozen. And when that happens, it's been extended another year, but we're now getting 6-7 years beyond the pandemic. The next time they'll look at STOA funding, there could be a significant drop, which would mean, a loss of several $1 million in state funding for TCAT would drastically impact our service. So to explain this again, they've frozen it at the 2019 ridership levels. It's based on a per rider and per mile formula. And our ridership is about 30% below pre-pandemic numbers. We are trying very hard in the next year, the next year and a half to build that ridership back up to pre-COVID levels, but we need to maintain our current service levels, and that requires additional investment. At the same time, we're having increasing expenses. About a quarter of our fleet is past retirement age. That means the buses are over 12 years old. Many of them have over 500,000 miles on them. Those buses are very expensive to keep running. We have 7 Proterra buses, 2021 year models, that are awaiting their fate, but they're unsafe for roadway use because they have frame problems. So this basically means we have to put more mileage on our older, dirtier, and more expensive diesels to keep them on the road. So we've taken delivery so far of 11 new buses. We're starting to get beyond this, but we have a number of vehicles at the middle of their life that require significant investment. There's currently 9 buses I have that need new engines. It's between a $20,000 and $40,000 job per bus. So these are vehicles that, again, they're 2016, 2018 year models. They're not new enough, or they're not old enough to get rid of. We have to continue to keep them running, and that's very expensive. So we need some additional funding to keep up with our maintenance needs, keep our service running reliably, and keep our fleet in a state of good repair. Insurance costs are another problem. So across the country, there's major insurance hikes. We are budgeting for between a 13 and 14% increase in our insurance. We've shown considerable improvements in safety. Every year we do have a reduction in our preventable accidents, and the preventable accidents we're having are of lower dollar amount. However, Syracuse, probably one of the closest properties geographically, they're looking at a 21% increase. There's less carriers in the market. There's nuclear verdicts are a big problem. This is hitting trucking really hard, and that trickles down into public transit because a lot of the carriers that insure transit also insure trucking companies. So a little bit about the underwriter share. This goes back to 2017. There's been minimal change in it. So if you go back to 2017, the total underwriter share, so if that's all 3 underwriters combined, has only gone up $374,771 since 2017. That being said, at the same period, our operating expenses have gone way up. I mean, I'm sure everyone can imagine running a bus in 2017 was a lot cheaper. Between COVID, tariffs have hit us particularly hard. The operating costs have risen, and they'll continue to rise while the underwriter's share has remained flat. So ultimately, this is putting a lot of pressure on us, and CRISA and ARPA, the COVID funding we received, that kept our underwriter share artificially low throughout this period. So this is a problem across the entire country. The regional administrator FTA, he came to visit today. We asked him what's going on with other properties, and he said they're all in the same boat. So in Philadelphia, they've eliminated 50 bus and rail lines. Chicago, they're probably going to have to eliminate 60% of bus routes. 50% service cuts in San Francisco. Rhode Island, they've already made a lot of drastic cuts, and Portland, Oregon, they've done the same thing. We are trying desperately to avoid that situation because that starts a cycle that becomes very difficult to correct. So if we are unsuccessful in getting this ask of an additional $500,000 per underwriter, we are looking at significant service cuts. We would have to eliminate 3 routes, the 14S, which serves the west side of Ithaca, 65, which serves Danby, and the 77, which serves Etna. We would have to cut weekend service in 4 routes. Late night service would be cut. There'd be significant cuts to service serving Cornell. And we would do our best to keep our core routes, which are the ones that, the routes that are the most financially strong for us to run. We'd try our best to keep those unimpacted, but there likely would be impacts, minimal impacts as well. So a little bit about our budget. You know, here you can kind of see in the 2026 proposed budget, this is with the increase in underwriter's share of $500,000 per underwriter moving forward from 2026 onwards. So this would be a recurring, new baseline, so to speak. Even with this ask, we begin to run a deficit of 1.6 million. So we start the year with a fund balance of 10 million. We should keep a fund balance on hand of about 6 months of operating expenses, which is around $10 million. By 2027, that deficit grows and it continues to grow, and that fund balance gets all spent. By 2028, that fund balance dwindles to $631,958. So I think this will raise the question on many of your minds is, why didn't we ask for more? I think the answer is, you know, we don't think that was realistic. We understand there's a structural problem here. The point of this ask is to try to preserve service. We're trying to use this ask also to address the funding gap and try to keep it from getting even larger, which would happen if we're unsuccessful with this ask, or we get a phased ask or a reduced ask. That deficit continues to grow and we run out of fund balance even quicker. But this ask tonight is primarily about preserving service. And we do recognize that there is a structural problem here, and we're hopeful that this will be something that may be addressed in future state or federal transportation bills, because a lot of public transit systems across the nation are facing this crisis. So this is the operating budget. I can come back. I can pause here if anyone wants to look at it or has any questions. Yes.
You mentioned the structural problem, and of course, Shauna and I are kind of painfully familiar with that. But as we build our fleet and add our drivers, and if STOA is restructured, as we're hoping it will be, this spiral may not happen.
That's correct. So this makes some assumptions that ridership growth is somewhat sluggish. You know, and that, again, there's talk of reworking the STOA formula in a way that may be more advantageous to smaller properties like TCAT. Senator Cooney, who's the chair of the Transportation Committee, he visited last week. There's talk of establishing a distressed transit property fund, because a lot of the transit systems, especially in the southern tier, are really suffering right now. You know, Centro has taken over Cortland because their system essentially was on the verge of collapse. So there is some hope, but I think all of that hope starts with stabilizing and growing our ridership, because ridership is the way that TCAT becomes more fiscally sustainable.
Thank you.
I'll be more than happy to come back to this slide when there's questions. So in our 2026 capital budget, we have a number of projects that are funded through a combination of federal, state, and local funding. We have 2 hybrid buses, those are on order. We have a roof replacement project, a driver's lounge rehabilitation project. We have to do some work to our garage floor. We have a new bus lift coming. We have a number of engine replacements and a diesel tank. So these are all budgeted for right now. Moving forward into 2027 and 2028, we have 3 battery electric buses that are unfunded, a CAT AVL system replacement that is unfunded, which is CAT AVL is the system that we use basically to communicate with all the buses and see where they are, and the riders use to see where they are as they travel around the community. And then in 2028, we'll need an additional 5 battery electric buses to keep the fleet renewed and continue with our commitment to a decarbonized fleet. So at this time, we don't have funding for those projects. The funding will likely come from federal and state sources, possibly competitive grants. There may be a small local match required, ranging from 10 to 20%, depending on the source of funding. So capital and operating are very different in transit. There's typically more opportunities for capital funding, and operating is the ongoing struggle. So a little bit about our fund balance. Right now it sits around 13 million, But of that 13 million, 1.5 million of that fund balance is liabilities. So the actual fund balance, you can use is around 11.7 million. That includes inventory, accounts receivable, and state and federal funding that's due. Only 8.7 million right now is cash. And again, industry standard is to maintain a fund balance that can cover 6 months of operating expenses, which would be $10 million. So about where do we want to go with this $500,000 investment? I think that's the question that a lot of people have tonight, and how are we going to use that to improve TCAT? Again, as I've said throughout the presentation, the way to achieve financial sustainability is to increase ridership, because that helps us both with fare revenue, it helps us with building public trust in the system, but most importantly, it helps us with state operating assistance. We understand we need to get that number of 30% below where we were pre-pandemic. We need to get back up to the pre-pandemic numbers to stabilize our STOA funding. So already we've taken a number of steps to do this. We've gotten 11 new buses so far this year. We've done a lot as far as addressing some of our vehicles that were in a pretty poor state of maintenance. We have a new capital improvement plan, so we're no longer kind of waiting till a crisis comes up and then that crisis gets the funding. We have a capital plan that looks at where we have needs, where we have funding, and matches those needs and funding. We are fully staffed right now for operators and mechanics. It's probably the first time in a very long time that we've been this comfortable with staffing. We are canceling far fewer trips. And between our maintenance efforts and our staffing efforts, this provides a more reliable service, it provides a more positive experience to the customer, and it allows more frequent service. And providing that positive experience to the customer, that is the way that you grow ridership back. So this is kind of the cycle. The opposite of the death spiral is more mechanics and more operators make the service more reliable, customer experience improves and ridership grows, and that helps our financial sustainability. All right, so any questions? And I'm happy to go back to any of the slides to go through them.
Questions? Veronica.
Matt, thank you for your clear presentation and for the underwriter's presentation the other day. So my question's not so much for you. I think your ask and context is clear, but in our budget book, I'm looking at the TCAT page, I can see it looks like maybe what we're looking at is budget lines for the entirety of TCAT. It kind of seems to match what was on Matt's budget slide. And I see that in the modified 2025 budget, at the calculation line down at the end, there's this number 1,037,374, which seems like about 1/3 of the underwriter's share for 2025 that he put up on the board. So then like 3 questions. Year to date 2025, that line says 2.8 million. 2026 requested, that line says 803,000. Up top, it says fiscal target 930,000 some, and I don't see the number 500,000 anywhere. So could someone make it make sense?
Yeah.
Like what I'm looking at the budget book and how it relates.
We put the budget together before the ask came in. That's why it's not in the book.
So why would it go down from last year?
Yeah, so that like 930,000 and the 800 some thousand numbers, what do those represent?
Norma Jane.
It didn't go down.
I figured I'd start walking and see if you'd let me talk. So there was additional revenues. So TCAT is also supported by revenues that come through the county clerk's office. So there were some additional revenues that were added to that. And that's both mortgage recording and transportation. It's getting late, so my brain's not entirely hitting off, but it is coming from the county clerk's office, and it's part of it's to support 100% TCAT, and the other part of it actually is part of our local share. To help?
Deborah?
Yeah, but that really doesn't make sense to me, because my understanding is that the mortgage recording tax piece was separate and apart always from each underwriter's share. So
Right, there's-
in the first instance, I don't think we should ever have reduced the underwriter's share by an increase in mortgage recording tax.
I have to pull up the budget, and so I can, so there's a portion of it that you're absolutely, that's correct, we don't adjust it. And then there's another portion of the revenue that comes in from, that is the county's portion. So it's a much smaller amount. I'm trying to think it's something like 364,000, I'm looking at Frank.
Yeah.
And so that piece never changes, that's never going to reduce our share. And then there's a smaller portion, I think it's like 180, if my brain is remembering correctly, it's 180-some thousand, and that reduces our local share, according to our resolution and agreement.
I think we need to dig a little deeper into this.
Yeah,
'cause
I'll
it's
send the
really
documentation so that you know what
confusing
that
to me.
is.
Thank you.
I would just point out that some of us had the benefit of your full budget presentation last week, and we thank you for that. Randy?
Yeah, thanks, Veronica, because I was confused by that as well. So what is the request? How much money are the 500,000 plus what?
It would be
Plus-
an additional $500,000 a year.
Over last year.
803,000?
No, well,
The 900 and,
So the request is whatever is here plus $500,000. So whatever here we have, the local share $935,000.
so $1 million
Plus-
for
yes.
something? Okay.
Yes.
Thank you. And also, I'm looking at the online portal here, and it looks at your projections for revenue, which have gone up quite a bit. And one of the ones is mass transit revenue, and it says 8.2 million this year. So far, you're at 4.1, but you're saying $10 million next year. What is that? Is that rider fees, or what is that?
So are you talking about the TCAT budget or the county?
It's under TCAT. I don't know what I'm looking at, I guess. It's the adopted budget.
But in the county budget book, right?
What's that?
Like you're in the county budget book.
Right.
Yeah.
I'm looking, it's the county budget book.
So that is a pass-through funding from state. And so if you look at the expense, there's 25 million, and the revenue is broken out to 15 million and 10 million. So they are all pass-through funding to buy new buses and stuff like that.
I think Frank Daldo might have a comment.
So my office is responsible for submitting TCAT's budget without knowing what the underwriter's share is going to be and what the request is, because of the time period that we have to upload everything. So I have to do estimates for mass transit. I might be wrong on this, so Daryl correct me on this. So we talk all the time and we meet once a month. So what I try to figure out is, what are the capital projects that TCAT's gonna do in 2026? I know all the grant money they have, so I estimate that number based on what I think the capital projects are gonna do. Then I have to estimate the STOA that's coming in. And is STOA going to the mass transit? I don't have my budget in front of me right now, so.
I believe so.
Yeah.
STOA is state funded. So that code, that mass transit 43501, the second digit 3 represents the source, which is state funding.
So the reason why only partial state funding is in right now is because we've only collected 2 quarters of STOA. What you're gonna see at the end of the year, January, let's say, you're gonna see all 4 quarters collected. Then in February, we get what's called cleanup funds. And because we follow, correct me if I'm wrong, Daryl, 13 months, they take those cleanup funds for the current year of 2025, even though we receive them in 2026.
That is correct, because it's supposed to, it's some calculation they do to clean it up the prior year, but by the time it lands in the next year, but we record it back to the year that it represents.
So we'll hit all our revenue targets for the state level. The federal level, the Fed transit, is going to be dependent on what projects are completed and what reimbursement requests are going to come in, but it's going to balance out. So if we don't have the expense, then we're not going to have the revenue. So it's called a net
Budget neutral?
Yeah, neutral, thanks. I knew, yeah, neutral. So that's why the budget is where it is. It's based on an estimate at the time you all need it submitted.
I know we had issues with the collection devices for fares. Are they up and running now, or?
They are. We have almost 100% uptime on them. Occasionally, dollar bill gets jammed or there's a power loss, and we usually correct that within 24 hours. But we are collecting revenue, and you can see in the budget forecast, that's why the passenger revenue jumps from 624,550 to 931,852 is because we're getting much better revenue collection from our system.
Okay, thank you for that. And last question, so we have 7 buses that can't be used that do we still, the county still have to pay for those? Is the sponsorship still paying for those, or?
So the buses have been paid for. They came from a number of different funding sources. There is a local share. I'm not sure off the top of my head what the local share is, but it's percentage-wise small. But say we sold the vehicles today without a waiver, the county would be responsible for the share of federal interest remaining in the vehicles, which would be significant. That being said, we've been working very closely with FTA. Frank has been working very closely with FTA. We are working towards a waiver to dispose of those buses early on, and I feel optimistic about our likelihood of getting a waiver. So those are not counted towards our operating expenses. They're not worked into this ask, but it is a situation that needs to be resolved.
You might want to explain why we need a waiver, because
the reason we need a waiver, long story short, they use a fiberglass and balsa wood composite body.
We took a tour.
Yes, and the rear axles separate from that body due to an engineering flaw.
No, I meant, so when you got a federal grant to pay for a bus, you have to agree you're agreeing basically to keep that bus for as long as the feds say its useful life is. And if you need to dispose of it for some reason before that useful life is over, you need a waiver, otherwise you're on the hook to pay the feds off.
Yep, just like, and that also applies to if we built a new building or any large capital investment, so that you can't just take the money and run.
I want to point out that it's 8:30, Corsa, and then Shauna, and let's see if we can move on to the other 2 presentations.
No, I think I don't have much. We're just putting our heads across in terms of what these numbers means. So if you look at the budgets, the amount at the bottom, which is the calculation number, is supposed to net our contribution, the local share to them. But because the reason why these numbers are bigger than our contribution is because of some of those delay reimbursements. So we are not getting those monies timely because we're giving the money to them and then getting the state reimbursement before we do our deduction. So for example, in 2024, the net here is 1.1 million. So there's roughly about $300,000 or so that we should get from a reimbursement that we haven't received yet, or it's just hanging somewhere that will balance our local contribution to TCAT. So and as Frank said, there's been many years of unclaimed revenues, and that is what is showing up here.
Thanks. Shauna?
Yeah, so I just want to do a Cliff Notes version of what Matthew is mentioning. Essentially, they're asking for $500,000. If they don't receive the $500,000, then there will be a cut in service. And pretty much, it's going to be across the board. It's going to be Cornell, it's going to be Enfield, Varna. I mean, he listed all the different locations. You know, the one thing, and Deborah and I are privy to it because we're on the board, but the one thing that we've noticed over the past year and a half or so is that since COVID, there's been such a dip, and it's been so nearly impossible to increase ridership. We've had tons of broken buses. We've never been fully staffed. And what we've seen over the past year is there's actually momentum and there's positive trajectory. Matthew and his staff are absolutely the A team. And if I didn't think they were on top of this and had what it takes in order for TCAT to become better, I wouldn't feel comfortable advocating for this. But I do think that we're seeing, for once, they're fully staffed, which has, since I've probably lived in Ithaca, has never happened. And we're getting new buses. We've used some from, I believe, Buffalo. We got some from Centro. And they're used buses that we're kind of revamping and putting on the road, and they've been really reliable. So for the first time in a long time, I feel really hopeful about TCAT. But it is going to take the three partners coming together. I know it's a crappy year for us to put forth $500,000, but we also have to realize this is the way that many of our people who can't afford cars, who can't afford insurance, who live in the rural areas, are going to their jobs at the hospital, to Wegmans, to the county. And, you know, to take that away, I think it could be devastating for the people that don't have the money to pay for a car.
Would be devastating for the county too, because there are knock-on effects, would harm businesses. You know, we've expanded a lot into late night service that benefits a lot of the entertainment and libation type businesses, and you know, that helps generate tax revenue. You know, for every dollar you invest in public transit, there's generally a return of $3 in the community.
And I think, just to add, I think also it keeps people safe because, you know, we have a lot of college students who go out to the bars, who have a few drinks, and the last thing we want is them on the road driving. And TCAT's taking drunk kids constantly from downtown, from College Town, back home safely. And so, you know, that's what they're there for.
So contribute to the drunk kids.
Yeah. Keep them safe. Keep them safe.
Can we serve on the buses?
Keep them alive. Yeah.
Matthew, at your budget meeting, I think toward the end, the question was, could this be ramped up over more than 1 year? And I think there was going to be some scenarios given. Is that still under progress?
Yeah, so I'm going to send those out tomorrow. I'm putting all that together. A ramp up, essentially, it makes this the deficit problem worse. Obviously, a ramp up is better than no increase, but you know, it does allow this funding gap to continue to grow. So that's, again, what we're trying to avoid. So I'll follow up with the numbers and the scenarios tomorrow, and I'll send them to Dan, and they can be distributed to the legislator.
I've got Mike Sigler next, then Deborah.
I mean, I guess my concern or question is, I mean, everything that Shauna says is important and can be true, but 2027 looks devastating. And then 2028 doesn't look better. And I'm just, I mean, there's one thing about turning the ship around. There's another about, I mean, those are just giant numbers. I don't know how you actually fix that, to be honest with you. So
that was my point.
So I think, you know, what we have to do is we have to stabilize the system. We have to grow ridership, and we hopefully will attain better than expected performance in both passenger fares, STOA. The Cornell service level agreement will be up for renegotiation, and that could be an area where there could be some adjustment needed to help balance this. But I think ultimately this will require attention from Albany, and I think it's critical that, you know, as we meet with our state lawmakers, that we talk about a situation like this, because I think that this is going to be beyond the resources of local governments to address. And again, it's not just TCAT that's struggling with this structural deficit problem. It's transit systems all across the state and the country, but the southern tier specifically has been very hard hit with you know, these types of funding problems. So, you know, the state policymakers are aware of it, but it's not something they're going to be able to address overnight. And I think long-term, you know, there's probably going to have to be some sort of a fund in the state and possibly federal transportation authorization bills that address these distressed transit properties.
Wrap us up, Deborah.
Yeah, I want to raise the point that I raised at the budget presentation, and this is more for Corsa and or Daryl than it is for Matthew. Last year, each of the underwriters were asked for $152,000, I think, each, to pay for a roofing project that apparently has now been funded with grants from elsewhere. And so my understanding is that the county did not disperse that $152,000. And if that is the case, then wouldn't this ask effectively be $152,000 less? Because that money was already budgeted and set aside and never distributed.
I'll have to look. I think if we did capture that in the budget, but this is a continuous funding, so this year may be different,
Yes.
but this is a continuous funding.
We can always hope for better times than years ahead, Corsa.
And one thing I just also want to help point out to the budget projection, as Mike indicated about 2027, they are projecting that this store funding goes away, the whole steady funding. So that's why they're looking close to about $2 million reduction in the store revenue. So if the state decide to maintain the 2019 levels again, that projections will change. But as of now, what they have been informed is that they'll hold steady for 2026. That's why you're seeing that significant decline in 2027 for the store funding.
But they've anticipated that it was going to be withdrawn year after year after year. So.
Absolutely. Yeah.
Yes, Mike.
Just lastly, I guess I'm just wondering if, say we fund this year, shouldn't we be planning for next year to some, I mean, this year we should be cutting that number, that next year number now, which would mean a contraction of service. I'm just looking at it going, I don't see how we get there. And I hate to say that. But that's enormous, that number. And I don't see you making that up through ridership.
Okay, you folks.
I don't want to be a negative guy, but I mean.
Folks still want to talk, so Veronica, then Shauna.
I guess, I don't know precisely what number you're looking at, if it's just the one in blue that stays.
$3.98 million?
The ones in red is what he's looking at.
Oh,
4.4 million going forward.
I can't even see that.
Well, those are worst case scenario.
But I think what I'm understanding also from Matt is the only way to make the budget better is through improving ridership. And the way to improve ridership is with investing in the system. Like, I don't see an alternative to that. And I'm completely unwilling to just let TCAT die and be a county with no, and I don't think anyone wants that, but it does seem like that is very much, we don't know, but depending on state decisions and stuff, but it's likely on the table.
It's not like that. No, none of what you just said is true. I said shrink service.
Well, excuse me then.
We're going to abandon, we can't abandon service because you've got a partnership with 2 other members on it. But if you're saying that we're not going to, Dan knows this better than anybody. You add a few miles to a route, it's freaking really expensive. And I'm just looking at it, and that does not look realistic to me.
So I'll be very brief, but I think the scenario that's most likely to happen is that the STOA situation does get addressed and that they rework the formula to be less weighted towards the ridership. And I think that will likely occur, at the time that they end hold harmless, but they'll put a new formula in action so we won't see such a drastic drop. But those conversations are kind of in the infancy level at the state. I think the state's well aware that this is a problem facing all the transit systems. And I think, again, we have to try to stave off these service cuts as long as we can. and hope for intervention at the state level, and in the future, possibly the federal level. But I think that that's the strategy here. And, you know, we're not asking the underwriters to basically balance this big structural deficit. We're really asking the underwriters to help preserve service so that deficit doesn't get even larger and become completely impossible to address.
Okay. Shauna?
Yeah, so I'm happy to wrap this up. Mike, I know you're getting frustrated with us.
Well, let me just say that we're going to have more discussion about this when we get to the voting meetings.
Right. Certainly will. You know, I think there are two other elements that we have not discussed, one of which is Gen Fair. We just got that up and running. For the past however many years, we have actually been having a rough estimate of how many riders we're having, but we also have a system where someone can walk on with a credit card, tap their credit card, and we're accepting revenue for that. That's something that we've never been able to do. So now more than ever, moving forward, we're going to be able to capture that revenue that we've never had. The second thing is, Matthew kind of skimmed over the MOU, and I'm going to dig a little bit deeper here, because per ride, Cornell gives TCAT so much money. That might arguably be a very low amount of money, and we need to negotiate that. And, you know, there will be certain people from the board that will negotiate that in the upcoming year. And so, you know, I think there are going to be some revenue sources that this is worst case scenario as far as I'm concerned. I don't think the numbers are going to be that bad. And, you know, I get what you're saying, Mike. Why are, you know, if this is a sinking ship, why are we going full force toward it, right? Like, you know, similar to how I feel about other operations that we have in the county. But, you know, I think this is one that we can actually save, because it's operationally, we're going on an upward trajectory. And I do think that the feds and the state are going to have to kick in, because every single transit system is struggling with this.
Okay, so we're going to wrap up now. Matt, thank you so much. And it was said at the budget presentation, I heard someone say that's probably the best budget presentation from TCAT that we've had for many years, and I would second that.
You're here.
Thank you. Sorry about the technical issues at the beginning.
Thank you.
We appreciate your coming.
Mike?
Yes, Amanda.
Well, we're going on 4 hours, and I would like to suggest that we take our last two departments on Monday, because
No, we can't. There have been meetings scheduled.
On Monday?
Yeah.
Caucus. Could be moved.
I understand.
Well,
what you're
I
saying.
think we're getting a little bit irritable, and we set that time aside, and we're going to be here for another hour and a half.
Well, let's try not to be there that long.
What meeting was
Maury
scheduled
said
on
he's
Monday?
quick. Why don't we have Maury go?
What
You said
meeting,
you're
public
quick,
meeting
right?
was scheduled on Monday?
Well, read your email.
I'd like to ask the body, not just the chair.
All right, I'm going to call Maury Josephson next.
Thanks, Mike.
I second it.
Yeah?
Second it, yeah. Okay.
Well, I make a motion that we adjourn for the night and come back on Monday.
I second that. Got it all in a second.
Keep going.
Been moved and seconded. Is there discussion?
Was it Mike Sigler that seconded?
Yep.
Or-
No, it was Randy.
Okay.
Or Randy?
I have discussion on it.
Why not? Go ahead.
When do we have to approve our budget by?
November.
So what's the hurry? So anyway, let's just do it, let's take our time and do it right. That's my thought.
We're exhausted.
We're taking. Veronica.
I think it's a reasonable suggestion to adjourn, but I also would rather just power through, even though I suppose the people presenting would have had to be here anyway. Sorry. And maybe we, including I, will try to take Mike's point that we can debate and discuss this all at subsequent meetings. And also the people presenting are going to be here at all the subsequent meetings because they have to be, thank you. So we can ask them questions later.
Katrina reminds me that she'd have to have time to notice a subsequent meeting to the public.
Okay. do it.
Well, we have a motion on the table.
It was on the public calendar. We all said it.
It's not on, these budget meetings are not on the public calendar, are they? I looked.
Yeah, they are.
Oh, they are?
No, they are, but I
They
don't
are?
think the like,
All right, all
The
in
maybe
favor
one.
of postponing the rest of this meeting, raise your hand.
Maybe I'm thinking of the forum.
1, 2, 3, 4, 4. And opposed?
Opposed.
1, 2, 3, 4, 5, 6. Okay, we're going to continue. Maury?
Thank you. I'm presenting the county attorney's budget. I would be as happy doing it Monday as I am now.
Such a diplomat.
Because it was real, this has been really an impressive meeting. And the fact that nobody swore until almost 9 o'clock is quite impressive.
I hope you'll have some rock and roll lyrics for us, Maury.
I feel like Shauna swore earlier.
I think I did.
Yeah.
That's all right. Next year.
But the presentations by my colleagues and the work that's gone into this budget is really, and the civility of the discussion about it is really impressive. And I hope mine will be brief because over the course of, I have mostly good news over the course of the year. I think things have shaped up very nicely programmatically and staffing-wise for our office because of prior actions by the legislature. And on this slide, there's an expanded discussion of our program functionally as the county's in-house law firm. And what we have is a very much expanded legislative advisory and transactional practice where the deals we negotiate are in the public interest. It's a privilege to negotiate these deals, to do leases where the lease is to obtain property to address homelessness, to contract for services that are delivered to residents, and where the advice to the board is on things like the 10th Amendment limits on federal requirements to enforce, for local enforcement of federal laws and other things like that. We're also a prosecuting office. We prosecute juvenile offenses and PINS cases. We're prosecutors with heart, and this falls mostly into the category of the wheelhouse of the deputy county attorney who puts heart and soul into collaborating with DSS, probation, the sheriff's office, and the family court to avoid incarceration, to avoid the kinds of situations we talked about earlier where a youth has to be sheltered for some period of time at the sheriff's office, and to help children from incredibly heartbreaking circumstances at least have an attempt to get their lives on track. We handle and oversee civil litigation. We can knock one more case off the list or the number that appears here. We just received an award of summary judgment in the county's favor in a prisoner civil rights claim. We've obtained multiple favorable results in employment law, administrative matters, and real property disputes. And we're also turning to using civil litigation as a tool to achieve policy objectives, like our collaboration with the city. Yes, we still have at least one going for local cannabis enforcement. And we have our evidence now, and we're about to kick that up to the next level. And of course, we have FOIL, And we're a county, I mean, everybody likes to know everything, but we're in a county where people especially like to know things. And we handle hundreds of FOIL requests a year. Many are routine, but some require a considerable amount of careful analysis to protect privileged information and protected health information and other confidential information of the county, and have some delicate negotiations with media representatives. So far, we've opened 356 requests this year. Our FTE report, our staff has grown with our practice. On this slide, you'll see, who we are. The one new for 2026 really isn't new. This was something that was approved mid-year this year. And, so it's not a new ask for 2026. We are 5, hopefully within a matter of weeks, we'll be fully staffed up. We expect to make an offer this week still for the assistant county attorney position. Our new paralegal aide started in June, and the whole program is coming together nicely with the additional staff. In terms of in terms of our budget snapshot, it really is entirely maintenance of effort. We moved some money around. We cut 4,000 from professional services and added 3,800 for furnishing. But like Jay, we could probably find some desks around and stuff for the new person, so we could save that money. It appears as an enhancement because it was moved. And we have an MOE of 21,000, which is the ongoing software expense. We've had a software package approved by ITS. We just need to button up the contract, and we'll be able to start installing that. So, and that's the MOE that appears on this slide. So the enhancements that we're asking for, and I'm not sure that they fall into the category of enhancements, is now that we've taken care of our program to a significant degree, which unfortunately much of which was overlooked over the years, we need to look at our people, and in particular retention issues. And I've put these in priority order. Apropos to Shauna's question about which of these do you need, you'll see here we got them in red. Those are the ones that are flashing bright that need attention. And what the enhancements are reclasses for the deputy county attorney, to put that position on a par with the deputy district attorney. The deputy county attorney is arguably a much more versatile and detailed position, requiring a lot more pivoting from one area of the law to the next, and has involvement in all areas of county operation, has a supervisory role. So the deputy district attorney position is the most comparable. That position moved up, but the deputy county attorney was left behind, which is an equity issue as well. The same for the secretary paralegal aide, as opposed to our just plain paralegal aide, because that position, it's really not secretarial and it's really not paralegal. It's a program manager type of position, comparable to the program manager in the assigned counsel program. Basically, that position coordinates all our activities and interactions with courts, administrative agencies, internally at the county. Basically, the person who digs up everything and coordinates digging up everything for FOIL responses and handling those operationally. And then finally, the county attorney which had historically been on a par with the county administrator. This position is the chief legal officer of the county. The scope and depth of duties, responsibility, and expertise required is outlined here and in a job description to be submitted to HR. These are things I'm working with Ruby on, but wanted to bring them up in the budget process so that room could be made for them. And the issue that had come up last year, which was I had suggested we likely need a new attorney, but it'll come up mid-year. But then when it was brought up mid-year, I said, a number of legislators said, well, how come you didn't bring it up in the budget? So I'm covering both bases here. I'm bringing it up in the budget, and we'll continue pursuing that through the HR process. As I note on the last slide, the ones that are flashing red, the one that flashes red most of all is the deputy county attorney position, less so the program manager, and you can get to the county attorney later because, as Susan had mentioned about the library, without the staff, there's really not a county attorney's office. So I'd like them those to be addressed first. And that's the presentation. Thank you very much.
Thank you, Maury. Deborah Dawson.
Thank you, Maury. So the $37,904 for the deputy county attorney, does that include fringes?
Yes, it does.
Okay, thank you.
Other questions? Veronica.
I guess two things for the furniture. I see it's approved, but I just checked and there's still a very nice desk in the surplus equipment and supplies section of internet. Don't know if it fits.
Don't know either because we have some odd-shaped rooms in our suite and we also still have some desks in there too. And I have a sense that the person will be offering the assistant position to will be happy with something functionable and reasonably comfortable. So if we don't have to spend that money, we won't spend that money.
Okay, fantastic. And my other question is procedurally, I guess you kind of addressed this, but if we wanted to support the reclassifications you're asking for, how do we line that up, budget-wise and HR-wise, since the reclassification is not our decision, but allocating money for it is?
I have talked periodically with Ruby about this in between various crises that we handle together, and do not have a full understanding of that, but I will. We're meeting tomorrow morning for a roundup, and I will try and have that to you before the voting meetings start.
One thing I just want to add is we have a form that will be filled, and then HR will reclassify their position and make decision is based on the changes to the job description. It has to be reclassified. The other side of it is we haven't done position audit in this county forever. So, for example, even though a position in DSS is similar to a position in whole health, if whole health requests for reclass, that position only get reclass. The one in DSS will not. And that is create that inequity issue. So it is essential that it wasn't in the request for the county administration or HR, but it is essential that moving into 2026, we look at a holistic classification audit to correct some of those imbalances.
Shauna.
Yeah, I'm glad to see that the FOIL software is finally taking form, and hopefully it'll be up and running soon. I did want to ask, Maury, as far as in-house representation versus us going to outside firms, it seems like you're doing more and more in-house, which is a great thing. Do you, and you probably don't have this number on you, do you have a comparison From this year versus last year on how much we spent on legal services?
I do not have it empirically. I do know that I will say the litigations being handled by outside counsel have been handled effectively, and they are helping us to whittle down the caseload.
Yeah.
But we are taking more litigation in-house, and I think we can do more of that with the assistant county attorney that we'll be hiring, both in terms of benefit to the county and benefit to that individual in terms of gaining experience. My preference in terms of use of outside counsel is to keep that to cases that are of particular legal significance or that require a particularly heavy amount of document production and the like. For example, if we get sued by the federal government over some sanctuary issue,
Sure.
I'd like to defend it, and I will be on those papers, but I want a powerhouse next to me.
That's right.
On something like that.
Okay.
But routine tort cases and the like, we should be able to take much more of that in-house.
Okay. Also, I did want to let my colleagues know that I spoke with Norma the other day, and I believe our county clerk, her job also needs to be looked at as far as reclassification. So I did talk to Norma about that, and she's going to reach out to Ruby because hers has not been increased in a very long time. It was not part of the salary study. So wanted to let all of you know.
Anyone else? Maury, thank you.
You're welcome. I know going next to last, you run the risk of being forgotten, so please don't forget us. And I turn it over to Corso.
What was your name again?
Who said that?
All right, let's do our last presentation, County Administration and Human Rights.
Okay, thank you. Being the last, I'll be very brief and quick. And I know we will not be forgotten. Because without art, there's no county. So
that's why you go last.
Yes. So we'll be looking at two departments. We look at, first of all, the Office of Human Rights, as well as the county administration. So share the screen. Great.
I start with that one, okay.
Yes, there we go. So, let me wear my glasses, it's difficult. So the Office of Human Rights, so as I said, I'll be looking at two. County Administration Office of Human Rights. The first one is the Office of Human Rights. So the Office of Human Rights provides a vital resource for county residents that are experiencing discrimination. Our mission centers on providing direct support to individuals while educating the broader community about human rights issues and also the protection that they are entitled to. On this slide, we provided various activities and programs that we engage in. One of the critical elements on here is the fair housing. As part of our CDBG program, we need to have a fair housing officer, and the Director of Human Rights has been the fair housing officer. So we'll be working with HR, with planning and HR in terms of properly quantifying that position. So in case there's a vacancy, that position continue to be held by somebody. So at the moment, I am more of unidentified fair housing officer, but we have to quantify that in the documents and ensure that we have continuity of those positions because it is part of a requirement for our CDBG programs. So there's various activities, including in-person, over the phone, the office working with the Commission for Human Rights and providing various services to individuals, and also providing referral services to individuals to various agencies. Just to clarify, as I have been informed over time, we do not provide specific investigation in human rights issues, but we're more of a program agency now that we're providing services and support and training and education to the community as a whole, as well as to the county agency as well. Next slide. So as part of those, since January as I came in, the position of Director of Human Rights has been vacant. So we currently have one person in that office in January who is entitled as a receptionist, but has been providing significant work in terms of coordinating work with the Human Rights Commission, working very close with the CEDO, the County Chief Equity Diversity Officer, and also, as much as possible, providing support to the community. A few years ago, I believe the agency did have a program manager title. So as part of reimagining human rights needs within the county, as part of the 2026 ask, I'm requesting that we restore that specific position to provide training, education, and program coordination for the Human Rights Office. Next slide. Also, the current start, just a quick budget snapshot. We have the Director of Human Rights. I'm asking to restore the education and outreach worker, and then we are looking at reclassifying the receptionist position to office assistant. HR is working on that right now. The total personnel budget for the agency, $317,000. Because the Director of Human Rights has not been filled almost this year, we are looking at I'm working with HR to get a position posted within the next few days, hopefully. And that has created a significant vacuum for the program. So I think when we get those positions filled, we need to really work hard to bring the position, to bring the office back to the community. A lot of education will be needed, and that's one of the rationale behind asking for the education and outreach worker to be restored. Next slide. So the enhancement, I've already talked about this, is restoring that education and outreach worker, and that is $89,723. If many of you that also were part of the presentation by the Human Rights Commission to HHS, emphasized a lot about the coordination, education, and the outreach support services, which we don't have anyone in that role at the moment, and we feel that this is such a crucial position that needs to be reinstated so that we can really be back in the community and engaging with our partners agencies and also the community organizations in supporting the rise, especially this time with changes at the various levels of government. So that is all for the Human Rights Office. I will take any questions, or if you want me to move on to county administration.
Shauna.
Thank you. I guess I'm wondering, I think the last time I had heard of what's going on in the office, there was conversation about really focusing on the education aspect in our community. And I think, you know, I look at the office that we used to have, and we had 2 people in it. And I guess I'm wondering what the director, if we were to hire a director and activities coordinator, that's not the position.
Program coordinator.
Yeah, program coordinator.
Education and programs coordinator.
It just seems like we're not able to do the same complaint grievance process that we were 7 years ago. What would that actual director be in charge of?
Okay, so the Director of Office of Human Rights is a chartered position right now in our charter. It is essential that for me, being new into a county that has this office, I'm also studying the impact of the specific role in the community and the changing climate that exists as well. We have discussed it administratively, some of the creative processes that we have to engage in terms of making that unit very functional and effective. There are aspects of those discussions that I believe at this point are not matured enough as part of our budget presentation. One thing I will say is that we have looking at other integration of services or combining functions in other units that may provide a better outcome, but those discussions are not at a level that is at the point where we can propose it or not. It's just an initial conversation to identify the likelihood or the possibility of those integration, or if those are going to be possible options that we can explore.
I guess I'm concerned because you're suggesting increasing the department by $80,000, is that right?
Yes, at this point.
$85,304.
$85,000, yet throughout your whole budget, you're actually cutting other departments. And you just said that you're still looking at options and whatnot. So this is not making any not much sense to me.
I completely understand the point you're making, but for me, I think the position of education and outreach worker is such a significant part of what Human Rights Office can do at the moment. We should evaluate the position of the director as is and make a determination if you want to post this as is. As I mentioned, we will come back to GO and have a conversation around the director position before we post it, because based on the guidance and information that we have discussed over the period, I think where we want the position to go will need to be discussed. We're looking at the maintenance of effort budget. That's how we maintain it as is. But my expectation is that at the next GO meeting, we can discuss an aspect of that position to see if there's if there's an option whereby we want to evaluate integrating that position with something else.
That position reports to HHS.
Yeah, I think
HHS, okay, yes, HHS, yes. Sorry.
Deborah,
so we
then
can
Amanda.
discuss that aspect, but I'm looking at holistically what can give us a better outcome in terms of the community engagement with a second proposed position that I'm asking for.
Deborah, then Amanda.
Yeah, I mean, further to Shauna's point, the director we had previously, the primary job that person had was to organize programs, outreach, and education. I'm really reluctant to add a position to do that, plus hire a director, when we're cutting other departments and not adding staff that they actually need on the strength of the hope that we might find something else for that director to do. So I really don't support this. I mean, pick one. Hire a director and have them do the education and outreach, or have an education and outreach person. I don't see at this point in time that we need both of them. If we hire one or the other, and you find that you need an extra person in the future, we can do it then. But I can't support this.
Yeah, let's keep to questions, please. Amanda.
Yeah, I'm not sure I feel quite the same way as Shauna and Deborah, but I wish, I mean, we had one conversation about this at HHS months and months and months ago. And I don't understand why we haven't had more conversations in the months leading up to this. And, you know, I know that the Human Rights Commission was consulted, but again, that was like in the summer. I am 100,000% against combining this with the Chief Equity and Diversity Officer. If that is on the table, that is not something I would ever support. But I do feel like I don't even know like what this department is supposed to do, or what has this one person who's been in the department been doing. I'd like to have a report on that. And you know, there's like a lot of stuff in the budget but you're actually cutting the funding for education and promotion. I don't know. It just, it's late at night. People are annoyed, and don't cut me off, Mike, because you wanted to stay here.
I was just going to say, Norma wants to make a comment.
So I feel like I will just reiterate that maybe we need to talk about this again at HHS, which I don't know is coming up still in a couple of weeks, but it's a bit of a surprise.
Norma?
I was hoping I could add a little context to this. So, if you might remember, I think a year or so ago, we had a department with 3 positions. So what we were trying to do in this budget was to put the department back together again in the way it was originally brought. When I started here in 2022, there was an outreach and education coordinator, right? So then it was omitted in error, if you recall, in 2024, I think, or I think it was 24. So we were just trying to put the department back together and called that position out specifically, because if you choose not to fund that position, just let me know and I'll put it in as an amendment. but so it was really called out pretty clearly a couple of times in the presentation, just to let you know that that's what happened. But that's the reason why it was done. It was just trying to put the department back together again. It's been a while. If the legislature chooses not to do that, then that's fine. But that was the purpose for it. Okay.
Veronica.
I guess comment and question. My recollection was with the previous department head that he'd been asking for and wanting an education and outreach coordinator for some time, and at least my impression was that work probably would have been better done by someone whose position was doing that work, as opposed to by the department head who had other focuses and other things he was supposed to be doing, and I don't think that he came into that role to do the education and outreach, and in particular social media promotion. That was a whole thing. I do recall, so before that, when there were more people in the department and before I was ever here, I was at some point outreached to and educated on through a whole program with using a Humanities of New York grant or whatever it is called, and that was very effective and wonderful and probably fell by the wayside with fewer staff. My question is, I had not thought about until recently, the fair housing work in this office, and I'm wondering, can you elaborate on that and what is the county, what's required of us fair housing wise? Because I know there's rules and things about this, but I don't know much about what comes through that world.
Yeah, absolutely. So basically, if somebody make a claim of being discriminated against based on against the fair housing law, that has to be investigated. My understanding was the director was the fair housing officer, but did contract with an agency, I believe in Rochester, who was in Syracuse, that was doing the fair housing actual work investigation and report generation for us. We have had a conversation with that agency. They are willing to continue that services for us. It's difficult to identify or hire somebody who has skill set in fair housing investigation and reporting. So we believe that whether the title stays with this position or assigned to somewhere else, we will still need to restate that contract for those fair housing work to be done. It wasn't, from what my understanding was, about $3,000 a year. So it's something that they have offered that they will continue to do that for us. So right now, if you receive any fair housing discrimination claim, we can refer you to that agency, go into an agreement with them to investigate that case for on our behalf. But it is stated in our CDBG agreement that we need to have a identified fair housing officer when we are submitting our report. So that is a significant part of the whole unit.
Thank you. Do we have that contract now with the organization?
I think it was my understanding, I stand to be corrected, the contract did lapse, but there was work ongoing that were paid based on the work allocation or on the need-based basis. But there's an option that we have that we can sign an agreement with them for the education and outreach training in terms of fair housing needs and expectations as well. So there's an opportunity there. We have had conversation through the planning office, and they're willing to continue that work for us.
Anyone else? Okay, Corsa, go on. You're next.
Okay, so I'll move on to the county administration. So, so the county administration serves as the operational backbone of the county government. We coordinate all departments implementing legislative policies and also multiple critical functions. We are involved in public information. We deal with the budget as you're dealing with right now. We also work closely with the county attorney's office in terms of FOIA, also compliance program in terms of federal, state, and local adherence, and also administrative policies and procedures as well. County administration also deal with contract and risk management, diversity, equity, inclusion initiatives, and as well as employee health and safety related issues as well. So currently our FTE is 12. We are not requesting any new additional positions. So this is just a flow chart of our current positions in county administration. Sorry. Next slide. Okay, so the department update.
Excuse me, Deborah, did you need to ask a question?
Oh, I'll wait until.
Okay.
Thank you.
The quick department update. We have had some contractual cost increases, and this is in the budget software, payroll software, communication, and website software prices. Cost has gone up. We have very few enhancement requests. This year, majority of our budget reflect maintenance of effort. And also, we have the Community Justice Center department will provide support through the program expense. So currently, the CJC is housed at the county administration. Our proposal going forward is to relocate that position into the city of Ithaca, and then we continue to support them administratively in 2026 through up to half of the cost of running that service.
Is the city of Ithaca on board with this?
Yes.
Okay. Thought it'd be good to know.
Yes, we have had significant conversation with them, and they have factored that position into their office that they will house it. Next slide. Okay, so as I mentioned, our budget is purely maintenance of effort, and these are some of the items that we are dealing with right now. So we can move on. Okay, so the maintenance effort, these are all cost increases. So the software, in terms of Canva, the website, and other things, the cost has gone up, which we did support. Also, service contract in terms of diversify Granicus, the social media archiving, UKG, as I mentioned earlier, these are all maintenance of effort, which we also did support. And we also supported an increase in $1,000 in program supplies.
Can you go back one slide? So the program supplies 4,000, but county admin recommended 1,000?
Yes, so the request was $4,000, and we basically reduced that request to $1,000. So the county administration is supporting just $1,000 out of the $4,000 request.
Okay.
So the other ones are professional services, that's translation, MSDS forms, and the request is also supported. And then the CJC program expense, it is here as a maintenance of effort because currently it's fully funded by the county and up to the same amount. So even though it's being moved to the city of Ithaca, we are maintaining the same level of funding. That's why we have it here as a maintenance of effort expenditure. next slide. Okay, in terms of enhancement, I believe we discussed over the time in terms of media monitoring tools and also AI chatbots to improve website search functionality. And we also discussed, I believe, we have been doing the climate survey tri-annual basis, and we have to do a new one in 2026. So we could not support $18,000 for the media monitoring tools. Also, we couldn't support the AI chatbots in 2026, but we did support the climate survey for next year. And those are the new requests that came in.
New things.
Okay, and yeah, and that's our budget.
Deborah.
Yeah, thank you. So I noticed that there were a couple of things that decreased pretty dramatically. There's a program expense decrease in the adopted budget from over $7 million to $2.5 million. And then there was also a decrease in federal aid of about $2 million. So what were those two things?
So the county administration, I just need to go to the
Norma's
line, but
here.
usually most of the grants that we write, go ahead.
Yeah, it's ARPA.
It's up.
Everything flows through 12/30, unfortunately, and so we've got we'll be really happy when that's done.
Yeah, I'm sure you will. So the federal aid decrease is ARPA.
Yeah, it's all
What about
ARPA.
the program expense?
and
Is
all
that
the-
administering ARPA? Or what?
For our administration of the ARPA, so everything that we've capped, all of
That
those.
makes sense.
Yeah,
Thank you.
yeah, you're welcome.
Amanda.
Something else comes up.
Yeah, thanks for the update of the pages that includes the climate survey, but you didn't recommend that.
Climate survey, we did recommend, we support the climate survey.
Oh,
If
okay, well, it's listed
If
as.
it's not there, I think, yes, the old page but we did support it here on the presentation.
the
So
new
yes, we
page.
supported the climate survey.
Okay.
In the online budget book, it says not supported in the text at the top,
Yeah.
even if the budget lines with their numbers
Yeah.
included. I'm not sure what budget
We'll
line
get
it's
it
in.
corrected.
Okay, but it is.
It is supported,
Okay,
yes.
great.
It's supported in the numbers itself, so yes, sorry.
Okay, so I have a few other questions. Let's see. Again, I love these contract pages. Under Zoom countywide subscription, it says 8,900 for last year, but nothing for this year?
I believe what we did was to break it down to the departments.
Okay.
And then department's supposed to fund it if they want to keep the services.
Okay.
So I think for county administration, we did recognize that in program expenses for us. But
Okay, so
yeah,
it's
there's a
going to be
reduction.
by
Yes.
department, okay.
Yes.
And then what about the translation services? I'm also a little confused because in the contracts page, it lists language, line services, and Empire translation services for $20,000 in 2024, but nothing in 2025. And then I think you list it somewhere for like, oh, on here, for 5,000. So what is?
Yes, if you remember, as we discussed, the previous translation service that we had is not supported by our current website. We have had meeting with Cornell that indicated that they could assist us through their language school in terms of our human translation service needs. There are ongoing conversation. I can invite Monica in to add to it. There's ongoing conversation with Cornell to make sure we have an arrangement in place for them to provide those services. If that is a path to go, it will be significant cost savings to us. But the one that was agreed, the contract that we had last year, that's why we haven't spent any money this year. Remember, I believe a couple of months we discussed it and the contract had to be terminated or not renewed for this year because we couldn't house it. And also some of the files that were previously translated, we're struggling to have access to them because they were not available. And some of the information, there was some degree of inconsistency with some of the information, so we decided not to proceed with that specific contract. But
Right, so
there's
I
still-
just want to note that was something that the legislature voted on the past couple years in our budget, was to spend significant large amount of money on that, and now you've decided unilaterally to move away from that and use something else. And so have we lost all of that information and money that we put into it?
It didn't work with the website.
That's right.
That's what I heard.
Well, that's not what I understood, but.
Yeah,
No?
it did not work with the website. We tried everything to try to make it work, and we could not get it to work with the website.
Okay.
But
Okay.
just to clarify on that, we still provide translation services on our website through Google Translation, and also human translation for all our static information. We are still able to provide those static human translated forms and things like that.
Okay, and then the AI chatbot you're unable to support that, and I was just wondering if that would be an ongoing expense if we.
If we support it, it will be, yes.
Okay, thank you.
Randy?
Yes, of course. In your budget letter, you stated that you're reducing 12 staff from 805 to 793. I just like a list of which positions those were by department, whether they're state funded or county funded. And any new positions that are being added, I'd also like to know that. If you just share that with us, it'd be great.
Yes, we will.
Reducing 12 legislators.
Yeah.
I vote for 2 at least.
We can do that immediately, some of us.
Things would work so much better.
No,
Ann?
I'm just volunteering if we're getting rid of legislators early. to
You're
save money
volunteering?
for budget?
Of course, I had a question. On the CJC, the 90,000, how long are we committed for that?
At the moment, we are not committed to that at all. I think the CGC was funded, I believe, correct me if I'm wrong, a 3-year program that ended in 2025. So this is a recommendation to continue. You can decide whatever you want to do with it.
So it could be a one-time or a two-time?
It could be one time, it could be multiple years at this point, and it will be presented in a similar fashion if you decide to support it this year.
Okay. Other questions?
I just want to also add that through our conversation with the city, they are hoping that we will support this position for a few years so that it can be stabilized into their financial architecture. They would really depend on this funding to support the position for this year. But over the next 2 to 3 years, they are looking at how they can raise funding internally or rationalize that position within their operations.
Okay. Anyone else? Yes, Dan?
Yeah, so I just want to ask about that CJC position again. Is the city paying half?
Yes, they have always been paying half.
Yeah.
So basically, the funding levels are the same, but just that where the person sits is changing. So from 2026, the individual is no more going to be a county employee, but a city employee.
Thank you.
Okay. Thanks for staying in there with us, folks, and I think we got through it. Our next sessions will be looking for amendments to vote on. I believe we've been sent out the form that I think Norma wants us to use for the amendments. I'll get you, Randy. And I just wanted to say we should probably get them in and see if you want to support any that folks have put in besides. Go ahead, Randy.
Actually, I'll speak to you privately.
All right.
Can you remind us about the forum?
He's just talking about the amendment.
Reminder of the budget forum on Tuesday, in case anyone in the future is watching this recording or right now. Tuesday, 5:30?
Tuesday, 5:30.
5:30, yeah.
This coming Tuesday, right?
Tuesday, 5:30, the budget forum.
And the public hearing are at 5:30.
Yes.
We're adjourned.
But the public hearing's like later.
But they're at a different time than these meetings.